failed. So
Yeah.
drove by Joe's Donuts, and my wife wanted to stop.
Oh.
That's good to know they're good.
All right, Madam Chair, we are live, and I will keep an eye out for Commissioner Willie, who's joining right now.
I'll wait for Commissioner Willie. There we go. Good morning, everyone, and welcome to this fine Tuesday, January 11th, 2022. This is Chair Catherine Harrington. We're in full work session today, and joining me is Vice Chair Jerry Willie and Commissioners Pam Treese, Roy Rogers, and Nafisa Fai. Welcome, everyone. We also have our senior staff here, our executive staff here with us, and as usual, all kinds of other staff members watching, Zooming, or listening to us from inside their offices. All righty, we have a healthy agenda today, so we're going to jump right into it. We do, under board and leadership communication, we do have a letter to consider later on, but first we'll start with board communication. Who would like to go first? No, oh, go ahead, Commissioner Willie.
Yeah, thank you. Well, mine's going to be short this morning anyway, just because of all of the catching up from last week. But I think the most interesting thing I did last week was I attended the Washington County Chamber's business discussion with state legislators. There was 13 legislators and about 88 people attended this Zoom, and it was made up of, I believe, 4 panels of small, medium, and large businesses and other individuals. Some other chambers from around the county were represented. And the legislators heard a lot of really good information about kind of along the lines of do no harm. They heard the message of enough on the taxation, but they also heard a lot of the businesses talking about what we've heard before, from the standpoint of the difficulty of getting employees, what they were needing with the certainly workforce training, and all of the some of the woes that they've been each individually having to just get back up to speed and certainly maintaining their employment. So it was a really good meeting. It went a couple of hours, and I thought it was very informational. Tonight, a few months ago, Ken Slagle from the County Emergency Management made a presentation to our Rural Roads Committee, and I asked him if he would take his show on the road a little bit and go to banks. And so that's where we're going to be tonight at 6 o'clock to hear an emergency management update. He had a lot of really good information, and that was something that the Banks City Council had asked for information on. So that's where I'll be tonight at 6 o'clock, and looking forward to getting that update as well. And then that's just business as usual. Thanks.
Anyone else?
Good morning.
Go ahead, Commissioner Fai. You're unmuted.
Good morning, everyone. Thanks, Chair Harrington. I'll keep it short. Last week was pretty busy with our board meeting and roundtable, but one of my highlights was doing a tour for the Marianne with Congresswoman Bonamici. That was her first stop for the day, early in the morning, and she was doing many other tours. So folks listening or watching this later on, Marianne is affordable housing for low-income families, and I'm really impressed with the work that they do, and busy week ahead. So I'll turn it to, I think Commissioner Rogers wanted to speak next.
Yep. I was just calling on him.
Thank you. Yesterday I had an interesting time talking with the Tualatin Chamber Advisory Committee, explaining the difference in the tolling project and the congestion pricing models, and what groups are weighing in and what those issues are. So I think they found that interesting. I am meeting again with them on the Thursday night for a meeting with their new CEO candidates. So that might be fun as well. Earlier that day, Jerry and I are meeting with Diane, as a matter of fact, on some CWS. Friday, we both, or all of us, have the 2 Senate district appointments, but early that morning, we have a quarterly meeting of workforce. So I'm going to be jumping out of that meeting to jump into the, I think our first one is District 16, but I'm not sure. But that's my week.
Commissioner Treese, anything you want to add?
Yes, I'll be fairly quiet today. I've had some complications from some dental work that was done, so I'm not, it's a little hard to open my jaw, but I did attend the meeting with Congresswoman Bonamici along with Chair Harrington. I'll ask that you do that report. I attended CPO 7 meeting last night. It was focused on Shackelford Road. I'll be following up with LUT about some of the issues that were raised there. I've also been attending some of the deputy briefing meetings, so that's been interesting and informative as well. With that, I'll turn it back to you.
I will gladly share more about the meeting on Friday with Congresswoman Bonamici. As Commissioner Fye mentioned, the Congresswoman was touring multiple facilities recently, looking at really focusing on the issues of affordable housing and houselessness. So in the morning, she visited the Mary Ann, the recently opened low-income apartment housing in downtown Beaverton, as Commissioner Fye mentioned. And in the afternoon, she visited the warming shelter, the seasonal winter warming shelter in downtown Beaverton at the Beaverton Resource Center across the street from the library, which is run by Just Compassion. It was a good tour. We visited the facility in their cleaning time between when the day shelter is open and when the evening winter shelter is open, operating out of the same building, just different parts of the building. It was really gratifying to hear how the supportive housing services measure is helping provide longevity for Just Compassion and the work that they're doing. So the case managers who are on board, who generally do some of this work seasonally, now have a 3-year career building tenure, which is good for all of us as a community as they work in their career path in social services and case management. So that was a good tour. Commissioner Willie, that presentation at ROMAC that you're taking on the road, so to speak, you might consider offering that up to the CPOs in your area, some of which aren't currently operating by Zoom because there have been multiple constituent requests from our western rural area. Both Commissioner Willie and Commissioner Rogers have a great deal of rural land in their districts, but particularly the rural community that is proximate to highways 26 and 6 have a lot of concerns about when there are crashes on those highways and when traffic is diverted onto these 2-lane rural roads. There are often detour signs placed at the crash site, but then not subsequent signage to help people get to another major thoroughfare. And so the rural communities are experiencing, in addition to what they characterize as cut-through traffic, because of growth in the the urban areas, these detours are causing quite a bit of angst. And there are very few places for people to pull over to look at their cell phones and the different directions. So it's a real challenge. And I know our LUT communications team has responded. We've seen it in our constituent reports on these, but the more that we can get the word out, the better off I think we all in the community will be. So thank you for following up on that good idea. For myself, in addition to some of the things being mentioned here, last night, the Forest Grove City Council heard from Washington County staff, LUT staff, land use and transportation, as well as from ODOT about the intersection improvements at Fern Hill Road and Highway 47 that has now leading to the completion of the alternative analysis, which has been a long time in coming. And there was an expression of frustration by one of the city councilors, rightfully, that the material didn't seem that much different. Well, that's because they did a presentation of what alternatives they were going to analyze. And now this is on the flip side of that. And, you know, rightfully, it's been a tough intersection for a long time. It just takes so bloody long for these improvements to go through the process, primarily because there are very constrained resources, funding. We know that well, but our community is quite frustrated over that. But a job well done for our team. Monday was the AOC legislative and board meetings. There is a legislative concept referred to as LC 97, which has been reviewed with the Coalition of Local Health Officers, and they are supportive, but I want to make sure that we are mindful of additional due dates. So this LC 97, I apologize for not explaining what it is. It directs the Oregon Health Authority to contract with a neutral third party to commission a COVID-19 after action report, which will be constructed by requiring local counties to deliver their after action reports. A preliminary report will be due November 15th of this year. A midpoint report will be due April 1st of 2023, and a final report is going to be due by September 1 of 2023. So if you're interested in further information, I can certainly send that around, but I believe we all have access to the legislative committee package. So just let me know if you have any trouble finding that. Yesterday, I had the monthly chair mayors meeting. We had a good meeting, syncing up on activities for 2022. I made sure to highlight our December 14th shelter program expansion so that they're well aware of the community engagement going on with that, and just, you know, the number of things that are on our plate. So really good meeting there. So I think that's it from me. We are just hopping with work. I thank all of our staff members for following through on all this work each and every day, especially during these COVID times. Which there was something else I needed to highlight that I hadn't written down on my reminder sheet. Yesterday's Tri-County Chair meeting, we were syncing up on how things were going with many different things, but particularly with COVID. So I'll come back to that when our various 3 executive staff reports speak to the state of COVID. But clearly, we have a lot of employees and community members who are being impacted by COVID spread in our community. I have 3 different sets of friends, personal friends who live elsewhere in the country, who all happen to be retired. And 5 of the 6 household or folks in these relationships have used at-home test kits, and have, because they have either contracted COVID or their significant other has contracted COVID. And they've gotten positives out of the at-home test kits and self-isolated at home and got better, and that's that. They didn't do any subsequent testing. So it's been really interesting to look at national news sources and see COVID presence all across the United States and realize that they're not even in those statistics because they haven't gone through hospital system COVID testing. So really interesting experience that we're having. And at that Tri-County Chair meeting, we talked about a couple of different aspects. There were questions about, so how is your county handling this? Are you still meeting virtually? Will you be going back to in-person? How is that going? How's it going for the schools? Certainly our schools totally have their hands full with all of this. And businesses are also, some businesses like restaurants are really challenged to stay open, and some are choosing to close for periods of time because of the COVID community impacts on their operations. We also talked about, as chairs, the challenge of leading these meetings entirely virtual, and how much work it is on us to do this. It is what it is. So we'll just keep doing it. I'm hoping that during the spring, hopefully by the spring, we can start talking about meeting face to face, because it's certainly a lot easier to chair our meetings when we're in the room and have the benefit of body language and seeing one another versus looking at people with heads down and things like that. So I'll leave it at that for now. If we could, at this juncture, look at the letter that staff has asked us, our government relations team has asked us to sign on to. I believe each of us had a meeting with our government relations team, as well as with our district attorney, Kevin Barton, on this matter of discovery and the Oregon Public Defense Services. Oh, hello, Aaron Doyle. Thank you for joining us. Please, if you'd like to give us an introduction on this letter, and we can go through any commissioner questions and discussion. Take it away, Aaron.
Thank you, Chair, and good morning, Board of Commissioners. Aaron Doyle here on behalf of your GR team. This letter was drafted last week as we continue to work with our partners, fellow counties, as well as the DA's Association, to find a response to the Oregon Public Defense Services recent decision to stop paying the reasonable costs associated with providing discovery when the DAs provide discovery to public defenders who are contracted through OPDS. OPDS is a state provided or state funded service that provides indigent defense through contracts with local public defense attorneys. As you are aware, with the meetings that we have all had, conversations with DA Barton, this is going to have about a $300,000 expected impact on county revenues, where we recollect the cost of some of the costs of providing the discovery back over. So this letter is mostly targeted at providing the awareness to the Washington County delegation and to seek their assistance in finding a remedy. We are not prescribing a remedy in this letter, but basically asking them through the legislative session to make us whole, regardless of who has been paying those costs directly to the county, be it OPDS through their budget provided by the state or directly from the state itself. We're going to continue to work with the Oregon District Attorneys Association's lobby team, AOC, and our sister counties in finding a solution during the legislative session, but we want to make sure that our delegation is aware of the issue, so we are not surprising them come February 1st when we're seeking a legislative fix. So that's what this letter is pointed at, and I'm happy to answer any questions or address any concerns you have with the letter. But I'm looking for a thumbs up today from the commission to get this signed and sent to our commission via email, or to our delegation via email.
Commissioner Fye, any questions, or are you thumbs up? Okay, terrific. Thank you very much, Erin.
Thank you all.
You got 5 thumbs. 5 thumbs up. Okay. Any last minute commissioner updates? Anything I might have forgotten? Nope. All righty. Well, we'll turn it over to you, Ms. Angie.
Thank you, Chair Harrington, and good morning, Board of Commissioners. Clerk Moss, if you could promote Assistant County Administrator Marty Kyle. So to start this week's update, I do want to start with a COVID update, and we'll be looking for Marty to provide a bit more information after I work through the workforce and operational stance. As the board may be aware, public health decided to pull back substantially from contact tracing in the community and instead devote the resources to vaccination. According to Dr. Sarah Present, one of our Tri-County health officers, she put it last week, continuing contact tracing in the face of the current wave of cases is like bringing a snow shovel to a tornado. I thought that felt very impactful and was kind of a reality check of where we are, both in community cases and then also within our workforce. She further indicated that it's a great tool, but it's not the right tool at this point in time for our current situation. We also know that employees in our community are facing challenges getting access to testing or doing testing at home because they don't have that access in other locations. With that in mind, I will share our COVID cases. However, our HR team feels that they are substantially underreported, given conversations with our departments and what the HR business partners are hearing from our workforce. So our employees known to be off work in isolation after testing positive is 15. Employees known to be in quarantine after being a close contact is 10. Given the measurements that I previously mentioned, it's no longer meaningful at this point in time to draw on a conclusion from week over week. So I won't be sharing that this week. Currently, from an operational stance, we are continuing to encourage telecommute. As far as our lobbies, we are working with individual departments to determine what makes sense for the department. So what does that mean? Our workforce is impacted right now. There is uncertainty of what will occur within our schools. We know that some schools are starting to transition to virtual learning. I will share on a personal level, I received an email over the lunch hour yesterday from my children's school district indicating that be aware we're close to the tipping point. So we're also answering questions from our working parents. what does this mean to our operational stance? So I'll have more information over this next week for your board on county operations. We are looking very closely, and it will not be a one public health operations.
Sure. Thank you, Miss Angie, and good morning, Chair Harrington and board. Marnie Kyle, I'm an assistant county administrator, and Health and Human Services is one of the departments that I'm working with. And so thank you to the Health and Human Services staff for this update. But we, as you know, continue to see sharp increases in cases. The cases have almost quadrupled since the end of December, and this is only January 11th. So our cases have almost quadrupled. In the past 7 days, we had 6,769 cases. That leads to a case rate that's 1,125 per 100,000. That's the highest number of 1 week total and case rates that I'm aware of since the beginning of the pandemic. Some good news to go along with that is that our community is receiving vaccinations, and that is, as Ms. Angie said, that is our public health priority. And so our vaccination rate at this point is 85.7 overall. And in 5 to 11-year-olds, it's still relatively low, 44%, but that's a pretty new population that's eligible for vaccination. And our 12 to 17-year-olds, the vaccination rate is 77.7%. So that's pretty good considering it's relatively new eligibility for that age range. As Ms. Angie said, we realize there is a very high demand for COVID testing, especially after OHA announced ordering 12 million at-home tests. It sounds like a really big number. They are prioritizing schools, and then they will be providing some tests to local public health. And although we recognize the interest and the desire for quick, easy access to testing, especially in the midst of this Omicron surge, we are really continuing to focus on our most vulnerable populations, the populations that have been disproportionately affected by COVID-19 and who have more difficulty accessing tests through healthcare providers or taking time off work, those kind of things. So really focusing on our low income populations, our communities of color, to make sure that they have access. And we're doing that, as always, in partnership with our community-based organizations. So the other priority really that public health is focused on is vaccination. Vaccination, vaccination, vaccination. If you haven't received your primary series, please, please do it as soon as possible. And if you're eligible for your booster, please get in and get your booster. One of the newest clinics that we have available for walk-in vaccines or boosters is every Monday through Thursday right at the Washington Street Conference Center. And that clinic is open for walk-ins from 10:30 to 7. For folks that are looking for where do I get my booster or my shot, or where do I get a test, the public health website is up to date. So I would really encourage everyone to go to that public health website and get information about, because it changes daily as the situation changes. So please go to the website and check where can you get your vaccine, your booster, or if you're interested in testing. So with that, I am happy to answer questions.
Chair Harrington.
Thank you. A couple of things. First, I'd like to give a shout out to one of the employees on the Washington County team, Cynthia Valdivia, if I've pronounced her last name correctly. As I have heard from multiple members of the MRC, the Medical Reserve Corps, I have really come to appreciate the work that she has done to help these volunteers show up and help their community. We're going on a 3rd year now of asking them to do this incredible work to help our community through this pandemic. So I really appreciate that. And secondly, I want to mention that I just read in the national press today an article dispelling the thinking or debunking the thinking that we should all just want to get COVID right now in this latest variant. And they were saying loud and clear, this is a serious disease. No one should want to get exposed and get COVID. It can still land you in the hospital. It can still kill you. It can still leave long-term symptoms. You can encounter long-term loss of your sense of smell and taste. It can leave you with long-term symptoms of shortness of breath, fatigue, and others. It's still a disease that our experts are learning more and more about. I didn't mean to give a summary of the article. Rather, I have had many people thank us at Washington County for the efforts, including keeping the Washington County website on vaccines and testing and other public health resources so up to date. It is a go-to place that members of our community are using and referring others to find resources. So job well done, and continue to do the incredible work of making sure that all of us as lay people in our community have access to that science-based informed information. Thank you, thank you, thank you. You have saved countless lives and reduced suffering. I meant to ask that as a question versus a declarative statement. So if there's anything you'd like to add, please do.
No, I appreciate you bringing up this, reminding everyone this is a really serious disease. And we may know people that have COVID, and because of vaccination rates, some people are having mild cases. But people are dying and people are in the hospital, and it is very serious. It is not something you want to get. It does not provide lifelong immunity or protection. So please consider getting your vaccination. If you continue to have questions, reach out through our public health website or your healthcare provider or pharmacist and ask your questions and learn more. So thank you for bringing that up, and thank you for the nice, kind words to staff. Cynthia is fabulous, and I will pass that along to her. She'll be thrilled. And also all of the public health staff who are planning and managing and leading these clinics, and the hundreds of Medical Reserve Corps volunteers. We couldn't do it without all of our volunteers, so thank you.
Two things, Marnie. One, when I tell you this, you're going to say I just got lucky, and I think I did. I walked in for about 6 or 7 weeks ago into a pharmacy and said, do you give boosters? And they gave me one on the spot. So I know that's unusual.
Yay.
So out of my question, well, I mean, people aren't experiencing that. Are we going to set up some things in this end of the county? I appreciate that we keep doing things in Hillsborough because it's around where you're situated. But there's a whole nother world here that people are saying they're not getting their boosters or not getting their vaccination as quickly as they would like to, simply because of access. So tell me what we're going to do for, and I don't know what it's like in the other part of the East County, which would be the Beaverton area, but I suspect it's very similar.
Mhm. I would encourage, I'll look at what's happening in our part of the county in South County. And also I would encourage folks to look at the website because it does list all of the clinics and pharmacies where vaccine is available. The other, I know it's not Tiger Tualatin, but Tektronix in Beaverton is another fabulous source for folks outside of the Hillsborough, Western Washington County area. But you know, it's a great point, and I will double check and see what else is available in Tiger Tualatin area.
And then my other question, thank you for doing that. I think that there's a lot of people who are quite willing, in fact, they're excited about getting something, but they just don't have access.
Yes.
Question I keep asking, and being asked, I don't know the answer. I just say I think that's what we generally call things. But vaccinations in the old days meant that you were vaccinated against something. This doesn't vaccinate you at all from COVID. And I think that's a misunderstanding too. People think, well, if I go get the shots, I can't catch it. That's not true. I mean, you can still catch it. It's just that you won't have the severity. So tell me, this might be a little more heady than anybody else wants to know, but why the heck do we call it vaccinations? Don't we have some better term? I mean, I get an annual flu shot. That doesn't vaccinate me from it, but I know that I'm not going to get real sick either if I do catch it. So is there something that I might have a snappy answer to report back?
That's a great question. So I think, you know, part of my response, and we could get Dr. Bowman to actually really explain, you know, why we call things vaccinations. But what I would say is that a lot of the vaccinations that we use don't provide 100% protection. You mentioned influenza, and influenza doesn't provide 100% protection against getting influenza, but it certainly protects you from hospitalization and dying from influenza. And the same is true of COVID. So you may still get COVID because viruses change and mutate all the time. And so you may still get COVID, but it certainly provides a lot of protection against being hospitalized or dying from COVID. So but I can ask, that's a great question, and I'll ask Dr. Bauman to help us to remind us our immunology and, you know, why we call some things vaccinations, and to give you a little bit more detail, because that's a great question that probably lots of people have and want to better understand. You stumped me. That's been his goal since last March.
Are there any other commissioner comments or questions from Ms. Kyle? Great, we'll turn it, thank you, Ms. Kyle, for being here. We'll turn it back to you, Ms. Angie.
Thank you. I did want to provide an update on the emergency rental assistance program. I recently sent the board an update, which staff and our community partners are really proud of the collaborative work that we've done together. To date, over 10 million has been paid, which is 62% of the Washington County's emergency rental assistance, called ERA 1 funds, and 77% is actually obligated. So what does that mean to actually people served? 1,514 applications have been processed and paid. The average household has been paid out $6,650. And over the last few months, as the board is aware, we have been working with Community Action as well as our community partners to determine ways that we can further our collaboration as we look at fully dispersing ERA 1 and also prep for ERA 2 funds coming in. So good conversations, good work ahead in that space. Chair.
Sorry, A couple items on that. When you sent us that email, I was so thrilled, but I was also tempted to turn right around and send it to our state legislative delegation, because I recalled that Governor Brown gave them all a message in the latter part of last year to press us and lobby us to try and get more of those dollars out, when in fact Washington County was doing pretty well all along. So I was wondering if that is something that the government relations team would be doing, or did they want my assistance as chair on behalf of full Washington County as an agency to share that? So that was question one.
Government relations can absolutely send this information to our delegation as a status update. I
Great.
do want to also indicate something that has made our disbursement process very successful is our contract work with OPHI. We currently have 13 OPHI employees that are helping with this process. In a staff update meeting yesterday, I'll call it put at ease that those employees will not be pulled for contact tracing, as it is viewed that emergency rental assistance is a form of responding to this global pandemic. So I am confident in our current operational status and continuing the same level of expediency and getting these dollars out.
Great. Related but slightly different. I just want to make sure that House Bill 2100 task force is on the radar, both for government relations as well as our housing team. This is a task force which has been tasked to address homelessness and racial disparities. And so for context, it goes back to looking at how the community action agencies have utilized different funds, and the task force is expected to deliver a first set of recommendations to the legislative committee on January 15th. We haven't seen that yet for AOC to take a look at that. So I just want to make sure that you and our subject matter experts in the whole arena of homelessness and utilization and partnering with our community action agency have this on your radar, in case during this short session there's some action or discussion at the state legislature. I just don't want our team to be caught off guard. Thank you.
Thank you for raising that. Thank you for the board support in submitting a city-county partnership homeless response pilot letter. Unfortunately, we were not selected as a county. The counties selected were more of rural counties in nature. And so while we weren't selected, we do look forward to learning from their pilot efforts, and it just lifts up the need for housing and homelessness services across the entire state. ARPA, it seems that when there's a spike in cases, there seems to be increased question as far as how the county previously spent CRF funds, or what are the county's plans with ARPA funds. And I think that's just because the sheer community need that we see that we've previously discussed. So staff are preparing to come to your board for an ARPA update and to share where we are with the expenditures of Tranche 1. Just as a reminder, we do have until the end of 2024 to obligate Tranche 2 funds, and till the end of 2026 to spend ARPA dollars. So our next tranche is a long runway. And so that will be part of our next conversations. And I do appreciate Chair Harrington's and Commissioner Willie's time and efforts on the steering committee. Due to the holidays and conflicts on calendars, we will be resuming those steering committee meetings here now in 2022. And that concludes my weekly update.
Commissioners, just to check, do you have any questions or comments for Ms. Angie? No. Okay, Mr. Carr.
Thank
floor
you,
is
Chair
yours.
Harrington. I'll just give you a brief update on the Supreme Court and the vaccine mandate, as I usually do. The Supreme Court heard argument on Friday. There was discussion of issuing an administrative stay. They have not done that. So the deadlines in the vaccine mandate are active. Oregon OSHA has said that they have to promulgate rules by January 24th, which would be effective 30 days thereafter, or February 23rd. So they're planning to do that unless the Supreme Court issues some sort of order in the near future. I think we can expect an order from the Supreme Court. My own personal opinion is that they will strike it down, but that's worth as much as anybody else's personal opinion, because you can't judge from questions judges ask, but they seem, more of them seem very much against it in their questioning. And that's what, if you read commentators, most of them are saying that, which probably means we're all wrong, because that's the way the Supreme Court tends to act. But that's my report. Thank you.
A little Supreme Court humor there. That's wonderful. Thank you. Ms. Taniguchi Dennis, Clean Water Service CEO.
Thank you, Chair Harrington, and good morning, Board of Clean Water Services. Just a couple of updates. We've expanded our emergency declaration to manage the supply chain shortages, particularly those that have a significant risk to regulatory compliance. The team is proactively managing the chemical shortage with sodium bisulfite, and I really want to give a shout out to our WRRD services manager, excuse me, Logan Olds. He's done great work utilizing his experiences as a utility executive in California. So he's identified vendors and trucking companies who are bringing us chemicals to keep us in stock until our regular supplier can resume their deliveries. Logan is actively working on diversifying manufacturing source and geographic distribution of our vendors so we can further reduce risk of supply disruption. So he's done a really great job, and we're very appreciative. We have our, on the COVID front, we have our on-site employee vaccination clinic today at the administrative ABC building, and all spots were filled, and staff is very appreciative of this opportunity. And our clinic, next clinic is at the Durham facility next Tuesday. The team is currently expanding the employee pandemic wellness kits to include some home test kits, so the team understands how to use those kits and how to access them. And they're also creating pre-planning lists of items people should consider having at home for pandemic preparedness for themselves and for their families. And the team is really appreciative of this. We have a significant number of COVID cases that Holly and her team have been proactive and really compassionate in their business approach to working with our employees to keep our on-site essential workers at work. We now have 8 confirmed new positive cases, and there are 21 primary exposures with positive cases in their homes that we're currently managing. We are able to maintain business continuity. We are taking additional measures for our on-site staff, and we're adapting their work, such as traveling 1 person per vehicle, utilizing KN95 masks. And this really is taking us back in strategy to where we were when the pandemic began outbreaking at the district. And it is complicated. The report that is in our work with our employees, there's usually 1 person in the household that'll get a positive confirmative case that make it into the official numbers, while the rest of the family members who are experiencing members tend to stay at home and recover, and they're actually not getting confirmatory testing. So I think that sort of anecdotal information confirms, Chair, what you were saying about the cases. We're also finding cases where positive household members occur, but our essential worker employee is negative. So it's quite a conundrum, this pandemic and how it unfolds in families and with friends. But we're actively engaged, and the team is trying to keep their spirits up as we support our families and continue to deliver our services. The team is actively working on the budget preparation, and we'll be talking with all of you about how to help make that full day not seem so full on that one day. So we'll be talking to all of you about that. There will be a Privy Council update that Mark will be sending out regarding our purchasing rules and some of the reasons for the updates, as well as updating you on our supply chain issues. So thank you, Chair.
Commissioners, any questions or comments for Ms. Taniguchi-Dennis? All righty. Thank you very much, everyone. Next, we'll move on to the remainder of the topics on our agenda for today. We're about 5 minutes behind on our estimated schedule. The next topic will be the North Plains Economic Opportunities Analysis presentation. We have some outside speakers, so Clerk Moss, if you could please advance all of those speakers, please. And we will turn it over to Matt Kriege, our Economic Development Manager, to intro the topic and introduce our guest speakers today. Thank you.
Great. Thank you, Chair Harrington, and good morning, Commissioners, and Happy New Year. I haven't seen you all yet. So for the record, my name is Matt Craig. I'm the county's Economic Development Manager. Just a brief introduction here to our speakers. I'm going to introduce a few of our colleagues from North Plains. As you all know, North Plains is a rapidly growing community. In fact, it's actually one of the fastest growing communities in Oregon. But while population growth has increased until recently, there's been little commercial development to provide more opportunities for local jobs and fiscal balance to provide essential city services and community amenities. In their presentation, the city's city manager, Andy Varner, and finance director, Bill Reed, will describe how the city is working to accommodate population growth while also striving to achieve their economic development aspirations. I will note that we have, Chair Harrington, we have 45 minutes for this agenda item today. And so after the presentation, the North Plains team looks forward to answering your questions and discussing this important topic with you all. And so with that, if Andy and Bill, you are on, I will turn it to you too.
Okay, well, thanks, Matt. Good morning, and it's still morning. Good morning and Happy New Year to all of you Board of Commissioners. I think I met a few of you in person, and then the pandemic disrupted plans to meet the rest of you in person over the last couple of years, but we'll get that fixed in 2022, hopefully. Bill is along with me. He is our finance director. He also has a background in economic development and UGB expansion, but this really is a dollars and cents matter for us in North Plains. And I think Matt's introduction was great. Honestly, we probably wouldn't even have to do a lot of this presentation because he hit the heart of the matter of what we want to talk about today. But nonetheless, we'll dispense with the slides, but we'll go through it pretty quickly. Chair
Sorry
Harrington.
to interrupt, Mr. Varner. I just want to give a shout out to Mayor Terry Linehan, who is on the attendees list. And she does great work as the mayor of North Plains. And I want to make sure we, at a minimum, recognize that she is here with us today. And Clerk Moss, feel free to advance her as well. Thank you.
Okay, great. Well, thank you very much. Yeah, I can't see everyone in the audience here, so thank you for catching that. I'd be remiss. So Yeah, Bill and I will go through several slides, and we'll definitely leave plenty of time to have a discussion for any questions that may pop up. But really, we're just going to tell a bit of a story about where North Plains has been and what we're doing now, where we're going in the future. And really, this story is about housing, about supplying housing for the county and the metro area, and trying to sort of supplement that and balance that with some economic growth as well. So I'm not sure the name of the person doing the slides, but please advance if you would. Okay, so as Matt alluded to, we're going through a UGB expansion study process right now. And we spent last fiscal year going through the first phase of that, which is really narrowing down and identifying the preliminary study areas outside of North Plains that we can expand into. And here's what phase 2 of the process looks like. We're obviously into 2022 right now, so we're going through the boundary location study process, working with our PAC, our Project Advisory Committee, to go through some of the criteria and the analysis and identification of proper expansion areas. And finally, that will all culminate later this year into working with county staff and coordinating with the LCD on an expansion process. And a lot of the analysis right now is being informed by a new housing needs analysis and economic opportunities analysis. The community has grown so rapidly that when I started this job exactly 4 years ago in 2018, and we adopted a new HNA and EOA within those first 2 years of my tenure, and we're having to go back and refine those right now as part of this UGB expansion process. So please advance to the next slide. And I think when you see charts, graphs, and numbers, that's when I cede my time over to Bill. So I think that is this is his portion. Is that right, Bill?
Yep, I think so. So thanks, everyone. It's a privilege to be able to share all this info with you and get your input. So here's where we've been in terms of population. 2010, the city had just under 2,000 population. And by 2021, almost 3,500 population. And that chart looks very dramatic in terms of its growth. Portland State and the Census Bureau weren't using the same information. So the Census Bureau only recently discovered how much growth has been going on. So that's why that chart looks kind of extremely sudden. But we're growing rapidly. It's been more than 5% annually on average for the past few years. And that places North Plains' population growth among the fastest in the county and the state. So we're seeing a lot of people finding North Plains to be a desirable place to live. You can go ahead and advance, please. So here's just recent building permit trends, at least since 2010 versus what we're expecting based on we have one major home builder in North Plains now, and that's Lennar. And they're currently about to start construction on homes for the Bryn Hill development, which according to their build out numbers and financial analysis, they're expecting to build enough homes to add about 1,500 more people to the city of North Plains in the next 5 years. And that will be about a 33% population increase. So we're going to add a third more of our population in just 5 years with just this one project. So they're as soon as building permits are issued, they are moving forward, and that's where we're looking at being in the next few years. You can go ahead and advance, please. So we also got detailed information from Oregon Employment Department about all of the employers within the city of North Plains in order to compare that to where our population and housing units have been. And that's what this chart just demonstrates. Over the past 5 years, well, at least through 2020, we added about 300 people during that time, according to the most recent numbers. But according to Oregon Employment Department, we really only added 135 jobs. We're grateful for the economic growth, but it just hasn't kept pace. And to us, what that really symbolizes is a bedroom community pattern that we don't want to get trapped in. It's going to get a bit worse here in the near term as Bryn Hill builds out, and we don't have much employment land left. But we want what we're planning for is to not get trapped in that pattern. But that's where we've been the past few years in terms of jobs housing balance. You can go ahead and advance, please. So here's just kind of one final exhibit, Census Bureau information. 98% of our employed residents leave town to work. The numbers we have is they're going to Hillsborough, they're going to Beaverton, they're going to Nike, so unincorporated county. They're working in a bunch of other places, but they're not working in North Plains, at least not yet. And so I guess the main conclusion, we draw from all of this is that we're growing rapidly. But really what we're doing is we're really kind of waking up to the reality that we're part of the county and regional workforce housing issue and solution, or have been. So that's where we are. And that's what we're trying to plan to counter or balance out as we talk about how we're thinking about UGB expansion. So you can go ahead and advance to the next slide, please. I think this is Andy now.
Okay, thanks, Bill. This has been in the news a little bit. So this is what we're getting at and attempting to at least provide some local jobs, services, employment, and kind of contribute to solving that imbalance that we have between housing and employment. For at least the last decade or so, North Plains residents have wanted a grocery store in town. You probably heard that if you've been in town or talked to anyone that lives in North Plains. They typically have to make a 10 or 12 mile round trip effort out of town to get some groceries. So the city and the Urban Renewal Agency, the URA, were proactive last year. We closed on purchasing a 5-acre piece of property right on Glencoe Road, so right off the freeway, and that's the shaded area in yellow there, close to our downtown. And we called that the Glencoe Opportunity Area, or the GOA. And the URA issued an RFP in the middle of last year to the developer community to place some of our priorities on there. First and foremost, a grocery store. We had other things like health services. We're kind of a restaurant desert too, so we could use some more eating establishments, multifamily housing, and even a hardware store. And Rimbold Development was selected to build on that site, and so we're going through the negotiation process with them right now. And that'll be a pretty exciting and dynamic project, right? Centrally located in town. It will get a lot of foot traffic, bicycle traffic, and vehicle traffic. So we're pretty excited about that. We have to see a lot more progress on that in 2022. So that's one example of the city and the URA trying to be proactive, at least on the commercial development side. Next slide, please. A couple more examples of what the city and the community have been doing to invest in themselves. In November 2020, during a pandemic, the voters did approve a local fuel tax, which was pretty awesome for them to do that. And really that's helping to fund a $6 million transportation bond to improve connectivity in town through pedestrian and bicycle access, a lot of sidewalks, doing some overlaying, things like that. The little map in the bottom right corner is the list of projects right now that the bond is helping to fund. Depending on how fuel tax sales go, we can add more projects to the inventory. You see a lot of that is geared towards making the old town, the older core of North Plains, a little bit safer and more connected, especially to some of the commercial areas. And the first project that the fuel tax helped to fund was the project that you see right there. It's 800 feet of boardwalk, a 200-foot walking bridge over McKay Creek, and that's all along West Union Road, a county facility, to connect the older part of North Plains to the newer part of North Plains and to make that safer. In the background, you can see a water reservoir that was recently built too. And if you go to the next slide, that's the close-up of that. That's 2 million gallons to help provide more water supply, fire flow, things like that for the coming housing demand, and we hope the commercial and industrial demand. So that's a 2 million gallon water reservoir and pump station just completed. It'll be fully operational next month. And along with that, we're also going through a new city hall planning process and a library expansion. We've got the nice recognizable cupola downtown, so we want to maintain that and expand the library. Next slide, please. We also received a grant from ODOT to do a downtown revitalization plan. So we're going through that process as well, looking at transportation safety and potential housing opportunities, and obviously commercial and retail opportunities all along Commercial Street from Gordon to Glencoe. So kind of boxed in by 2 county roads, we're looking at the entire downtown corridor as well. Next slide, please. Bill alluded to this earlier. This is the PSU population forecast, looking out an additional 18 years now. We're at 3,400 people-ish right now. And the projection you can see on the right-hand side out to 2040. So like you said earlier, we're here today and going through all this process right now through the economic opportunities analysis to provide more employment opportunities, not only for North Plains, but for the county as well. So we're not only supplying those bedrooms in North Plains, we want to have a better balance, especially to bring some, tax diversification is always a buzzword in government circles, but it really is true. It's residents that pay a lot of the property taxes that provide our services, and we need more of an employment base to help with that as well. Next slide, please. And so to help stem that the process, our council went through a visioning session over a few meetings during the summer and came up with 4 priorities for economic and community development. All of this is in your packet, so I'm not going to read it, but it's standard community and economic development language when you trying to reverse a trend of being a bedroom community, expanding and diversifying employment, growing and attracting business investment. So that's what a lot of this is about. So you can read those priorities, but that's what's important to our leadership. Next slide, please. Bill, this is you, I think.
This is me. So just a bit of a slightly higher elevation lay of the land. You can see North Plains and our neighbors Banks and Hillsborough. But, North Plains is, an island of undesignated land, as well as land within our UGB surrounded by rural reserves. And Hillsborough is our closest neighbor, but we're kind of in a keen location in terms of where we can potentially grow. It's limited by lands around us that are undesignated, and of course, rural reserves. And, as far as how we're thinking about growth, one thing that's been interesting about that Glencoe Opportunity Area project is 2 of the major tenants that are going to be there, Fresh Foods grocery store and Public Coast Brewery, are both Cannon Beach based, originally based businesses. So what we're seeing also is kind of an economic linkage beginning in North Plains between the coast and the valley. And we're excited about what that can mean for North Plains in the future. But anyway, this is where we are relative to the Portland Metro UGB and the undesignated lands around us that we're studying right now. And the other thing to point out about this is the white area just south of North Plains on the south side of the freeway are exception lands. And so that's where we have to look first, and that's where we're putting a lot of our attention about what and where might be able to work and how suitable that land is. And right now there's an old ag industrial facility, a seed storage facility, and an airstrip community, a bunch of residences that look a lot like homes on Meek Road in Hillsborough off of Brookwood, but with an airstrip in the middle. And then there is a farm or two as well, kind of in between. So that's where we're kind of putting a lot of our effort at looking, at least initially, per state law. So we're moving forward on that. You can move forward, please. So with that new population forecast from Portland State University, the first thing we were able to do, because it's a little bit of an easier effort, is update our housing needs analysis. And so the numbers that you see on this spreadsheet reflect the work on finding out what our housing needs are through 2040 and the resulting land need we need to think about for UGB expansion. And so what we're looking at is just under, well, just a bit over 167 acres for all housing, parks, trails, and open space, infrastructure. And we haven't identified a need for more schools. We have a brand new elementary school in the city, in the newer part of town on the east side, but we haven't identified a need for even more school space or facilities with the amount of growth in population we're looking at. So that's why there's a 0. But that's our housing needs analysis information right now, the very recently updated information that we're working with. You can move forward, please. Okay, so the economic and opportunities analysis is currently underway. We're updating it for all of the different reasons we mentioned. Our rapid growth, we're in the middle, hopefully, the waning side of COVID, and that's effect on the economy. The previous EOA was done before COVID was a reality at all, even a thought. So we're doing all of this work to kind of understand the economy moving forward long term and what opportunities there are for the city with the best of most recent available information. We've had the privilege of teaming with some folks to kind of help us with providing information and thinking about economic development in North Plains. So here's a list of different entities and partners that have been sharing information and working with us. So that kind of frames or lets you know how and what we're thinking in terms of planning moving forward, in terms of what to do about employment in the city over the long term. Next slide, please. Okay, so, and how specifically are we thinking? I mean, North Plains is the next, Jackson School Road is the next freeway stop on Highway 26 from Hillsborough. And the slides here show what type of employment growth, what type of buildings, what type of uses and employers have located off of Brickwood up north of Highway 26 in North Hillsborough. It used to be called the Helvetia Industrial Area. We view it as kind of based on our work and based on conversation with the folks who are helping us. It looks like probably the best example of how to think about what employment growth might be looking like if we plan for it. And it's really just a mix of uses, no pie in the sky, 100, not necessarily a pie in the sky 100, 200 acre gigantic user that is a home run sort of thing, but just a mix of different types of businesses needing a mix of different types of space, smaller firms that need kind of business park in the bottom right-hand corner, or it could be individual businesses in their own building. Everything from perhaps data centers, some part of the mix, to manufacturing. There's a really nice mix of employers in that Helvetia industrial area. And since we're so close, it only makes sense to think about what might happen in North Plains, looking at that as the closest example. So that's how we're thinking about it very specifically and how to plan for it. So next slide, please. So this is really kind of just the Oregon administrative rule about EOA and how a city should think about its visioning and assessment of its potential. And we're taking ORS and administrative rules for Goal 9 and doing the EOA work very seriously. We're looking at economic development in the city that's unprecedented in terms of the types. There have never been those types of industries in North Plains like there are in Hillsborough nearby. But we see it as just sort of a natural pattern of employment growth in the county to come our way, just like population already has and the workforce that is now living in North Plains but commuting elsewhere. We see a similar pattern of that moving towards us and trying to plan for the best of it and an appropriate amount of it. But this is really kind of just from administrative rules for doing EOAs that's guiding us. Next slide, please. So I think, Andy, I think this is you.
This is a conclusion slide. It's just a reiteration of the map at the beginning. So I don't think we need to belabor that anymore, but we plan to get a lot more work done in 2022. We hope we can work with you folks and the county staff, obviously, on any expansion discussions in progress. So Bill and I are happy to have a discussion, answer any questions you may have.
Commissioners. Go ahead, Commissioner Willie.
Thank you, Chair. Thank you, Andy and Bill, certainly for this presentation. You know, you and I have had a lot of conversations about this. I'm glad to see this is moving ahead. North Plains is in a perfect situation. I know that you don't want to be a bedroom community, and you're certainly working really hard on providing plans and a vision for a good work balance. And so, you know, I applaud that. That pedestrian bridge is spectacular. As you know, I drive through North Plains on a regular basis to visit that nice little green space you have north of your city. And every time I do, I'm just amazed at some of the growth that you can see right along Glencoe there, and of course out in off of North Avenue there in the new residential area. So congratulations, good job, keep up the good work. And like I said, I think North Plains is perfectly positioned to provide have that balance that you're talking about, and it takes a lot of work to do that. So thank you for doing that.
Other commissioners? Questions, comments? Go ahead, Commissioner Treese.
I'd like to echo what Commissioner Willie has just said, and it's really nice to see both Bill Reed and Andy Varner in your roles there in the city. And I'd also like to call out Mayor Lenahan for her leadership around these issues. So thank you, and I'm pleased that Matt's working in coordination as well, because that was the role that we wanted Matt to play, and he's doing a great job there too. So wow, the population growth headed up, and the planning is just spot on. So thank you.
If I can just have one little rejoinder there, I would concur that Bill and I and our little small staff, we can't manage all the growth, and our council, Mayor Linehan, we can't manage a lot of that in the planning ourselves. So having an economic development staff with the county to help us supplement that, and the attention that we know will be coming when North Plains has the opportunity to provide some more, for instance, industrial lands in the metro area. It will be a lot of work for us. So we definitely will look forward to working with the county in that to help us manage a lot of those issues.
Mr. Craigie?
Thank you, Chair Harrington. Just to jump in on that, I'd also like to call out the county's land use and transportation staff that have been working very closely with the city of North Plains on a variety of projects, transportation projects, and some of their land use. So we're working to integrate land use and economic development here at the county, and we look forward to continuing the partnership with the city of North Plains and all the cities across Washington County. So thanks.
Commissioner Rogers.
Yeah, thank you for the presentation. Terry Lenahan and I have talked over the years on a variety of matters, not so much on this one, but I echo the comments that she's doing a great job as mayor. I'm a little confused, and that's only because I'm from the outside looking in as to what the strategy is as far as the business type you're looking for. I would just offer some comments, and you can certainly disagree with them. They're just thoughts. There are lots of major cities, lots of major areas who have wastelands of businesses sitting there unoccupied. With the gig economy and with people looking at work from home, I'm not so certain that measuring big box footprints is the way to measure employment. I think it's jobs generally. And I'm not certain how you define jobs, whether that means that a job means that you have a W-2 for an employee, or whether it's a self-employed person working out of those homes. So your actual employed people in your community might be much higher depending upon how you define what a job is. And so I'm not sure what you're doing, but that's one comment. Secondly, in regard to the big box, I was teasing Terry one time that she's a tax haven there because of your location and what jurisdictions you're located in. And so I suspect that others might find your cities as a desirable place to locate. It might be a post office box, but they'll find it and say that there are some advantages to locating in the city of North Plains just because of your taxing structure. The other point I would make is that I'd like your other commissioners who represent you excited to see your growth. I don't think you're an island. So is Monaco. So is the Cayman Islands. So is a lot of places are small geographic areas, but they have mighty might. Switzerland, I mean, they're not big, but once people discover what you offer, they become very entrenched. I would love to see. I went on a trip a couple of 3 years ago before pandemic to Brooklyn and saw some of their incubator facilities out of the old Navy yards and other facilities that they were converting. Now you don't have exactly those old buildings, but I'm wondering as these high-tech companies begin to discover that maybe they don't need these superstructures other than to produce chips with ever fewer employees because they can use robotics. What are going to happen to all these little incubator businesses who are working out of their garage, you know, the little ones like the Apple at one time and Nike at one time. And I think that you might find that some sort of a high-tech incubator so close to the production center, but not being a production sort of town, but providing those kinds of services might be very interesting because young entrepreneurs or old entrepreneurs, doesn't matter age, I guess, are looking for smaller spaces that they can do very creative things, and they quickly evolve from 1 to 10 or 15 or 20 employees. These are not low paying jobs. I mean, these are very, very good. But yeah, those are just a bunch of random thoughts. I get excited when I see what you guys are doing and saying, okay, well, what is your vision? What do you want to be? Big box. I mean, if you attracted 2 Costco's and 2 Walmarts and 2 of this, and I mean, you don't know where I'm sitting. I'm sitting in my office, and across the street I have a big box. You know, the employment isn't all that great, and from a tax perspective, I had people when the light rail was looking at this. They say, you know, you on your building pay more taxes, property tax, than the Lowe's across the street. Now I can tell you the Lowe's across the street's a bigger building, but I guess they assess on me a whole lot more. So I think if you're looking for property taxes, take a look at you know, things like how do you generate it from maybe higher value property, what kind of jobs you're looking at, because you've got a really neat little town. I've got something similar in King City here on this end of the county, and they're small staff and they're doing the same exact thing. And I said, aspire high, because you don't know what you have until other people come one day knocking, and they will tell you what you have, but hopefully you've already planned for that. So anyway, just a bunch of random thoughts. Thanks.
Mr. Varner, Mr. Reed, is there anything you'd like to respond to from that?
No, but I would just say aspiring to be the next Monaco or Switzerland of Oregon sounds pretty good. I think we should shoot for that. I hope our EOA bears that out.
Thank you. Any other last commissioners, district commissioners? Okay, I'll make my comments.
Chair Harrington?
Yes,
Sorry.
please.
I'll just be really quick. Sorry, I was kind of late pushing the unmute button. This is a great presentation. Thank you so much, Andy and Bill. And I'm really glad to see, Matt, you working with City of North Plain. Mayor Linehan and I did a tour of the city and saw really a beautiful city, very quiet, very clean city, I would say. And I really saw everything that you presented. So as a commissioner far away from North Plain, I want you all, the staff, to know, and the mayor, ready to support whatever you need from the board. So keep at it. You're doing great.
Okay, so I'll make my comments. Thank you very much for the presentation. I have watched the work that has gone on for many years now. I think Mayor Linehan, in stepping forward as the mayor a few cycles ago now, election cycles, has really increased the visibility and involvement of many members of the community into the city's work, the visioning and the planning that goes on. So I've been a careful observer of the work that has gone into this through your various advisory committees, including your planning commission and then to your city council. Really taking ownership for where North Plains is and better understanding what the future vision is and going through the requisite work for that. I understand completely that as you move forward, you have to satisfy the Oregon land use laws as they exist today. There's lots of speculation and early data about how the workforce of the future may behave. One of the things that we've learned during COVID is where we find ourselves today is that only 1 in 4 workers can continue to work from home on a regular basis. All the other employees have to show up physically somewhere to do this work. And we can't forget the fact that we are all human. And as much as we've been effective working and meeting in these Hollywood squares and taking advantage of other electronic mechanisms, there's nothing quite like being physically in a room together. And those more casual, impromptu conversations. So I don't believe you are finding yourselves in a process that will allow you to move forward with a basis for a expansion request on things that aren't yet clearly part of the rule set that you need to meet. I believe that from what I have seen, you have made best efforts to go through the process. And just as I have supported the planning work from Tigard and Sherwood and others while I've been a county chair to move forward, so too I support your advancing through your journey with these requests. So job well done. Thank you, Mayor Linehan, to you and your city council colleagues for doing this work. And it looks like Mayor Linehan would like to join your presentation. Go ahead, Mayor Linehan.
So can you hear me okay?
Yes, we can.
Great, thank you. I had not planned on speaking because I think Bill and Andy has done a fabulous job in the presentation, and I want to publicly thank them and just tell them how grateful I am for their work and their effort and their just long hours in getting this ready for you and the others to view. And I also want to just commend and thank you to the commission for your work. And again, we're moving forward, and we really hope to have a beautiful island, so to speak. You know, I mean, I'm with Andy. I think being a Monaco or something like that would be awesome in Oregon. But anyhow, just really appreciate everybody's time and your work and your support in helping North Plains move forward. Thank you.
Well, I think that's a wrap.
Thanks for your time.
All righty, so next we'll have, thank you. Next, we'll have a 15-minute break. So we will reconvene the Board of Commissioners work session at 10 o'clock. Thank you, everyone.
Madam Chair, you might mean 10:15 because it is 10 o'clock.
Yeah, that's what I was wondering.
usually say, and it is, so we will then. It's 10 o'clock. See you at 10:15. Hello, everyone. Sorry I bungled the time announcement for our break. We now find ourselves at 10:15. So time for us to reconvene. So we're off to the races now as the expression goes, back as work session colleagues. Our next topic is an update on the Emergency Medical System Code 8.32 and administrative rules. This is one of the topics where we have an updated packet yesterday, which added a PowerPoint presentation. So just to make sure commissioners are aware of that. So I'll turn it over now to our Interim Director of Health and Human Services, Mira Samantha.
Chair, if I could jump in just for a second. I can't turn my I can't turn on my video because it says the host has disabled it. So I will probably have to jump out and come back in.
Yep. No, there you go, Commissioner Willie. You didn't turn it off during the break, so I was helping you. So my apologies.
Thank
Thank you. Thank you, Chair Harrington. So good morning, Chair Harrington, commissioners. My name is Mira Samantel, and I'm the Interim Director of Health and Human Services. I'm pleased to be here with you this morning to introduce Marie Bowman Davis, our Public Health Division Manager, and her team, who will be providing you an overview of the process used to update our Emergency Medical Services, or EMS, governance documents, and to propose amendments to the EMS Code 8.32 and EMS administrative rules. So with that, I'll turn it over to Marie, who can introduce her team and take you through the presentation they've prepared for you today.
Thank you, Mira. Good morning, Chair Harrington, and good morning, commissioners. Could we advance the slide, please? Great, thank you. So again, for the record, I'm Marie Bowman Davis. I'm the Public Health Division Manager and the appointed Public Health Administrator. I will be going over the slides about the statutes and the roles of the commissioners. Adrian Donner is our EMS Program Supervisor, who will provide an overview of the governance document and our updates. And then Tim Case is our EMS Senior Program Specialist, will provide an overview of the types of changes made to our Washington County Code 8.32 and the EMS administrative rules and highlight any significant changes. Next slide, please. So here's a quote from our ORS, or our Oregon Revised Statutes, that'll help guide us for today. Each county shall develop a plan for the county relating to the need for and coordination of ambulance services and establish one or more ambulance service areas consistent with the plan for the efficient and effective provision of ambulance services. Next slide, please. And so there are three primary areas that we're looking to the commissioners for support. And so the commissioners approve our county code 8.32, our administrative rules, and our franchise agreement. So as we propose changes to the code and the rules, they'll be reviewed and advised by the EMS Alliance and stakeholders. And then the franchise agreement is reviewed and advised by the Washington County EMS office. And then the commissioners will be asking later this year for an endorsement of our ASA, which is our ambulance service area. That will then be submitted to the Oregon Health Authority, or OHA, for their approval. That's under OAR, or Oregon Administrative Rule, and regarding procedures for adoption and approval of ambulance service plans. And then last but not least, we look to the commissioners when they approved 190 intergovernmental agreement to create the EMS Alliance, which our CAO appoints our county representative, which is currently ACA Marnie Kyle. And then our cities appoint the representatives, and currently all appointed representatives are there. All the appointed representatives are fire representatives. So I will turn it over to Adrian.
Thank you. So I'm going to overview a little bit about the 4 documents. We're bringing 2 of them to you today, but as Marie said, we're coming with more. So giving you that how they fit together seemed helpful. Our 4 governance documents are the ambulance service area plan, the code for EMS, and then the administrative rules and the franchise agreement. All 4 are undergoing a process of revision at various steps right now. And they really fit together like an upside down pyramid. The ASA really is an executive summary. It covers all the things that the Oregon Health Authority requires of us, and gives a grounding for how EMS works within Washington County. Of course, as you know, our code then governs the specific rules for the EMS functions, and then we drop down into admin rules, which get more detailed. Those are the rules that are the partners within the EMS system have to follow in order for us to provide a quality system across the county. And finally, the franchise agreement, which is a contract between the county and the Emergency Transport Agency. So they each fit together and serve their own purpose, but tell a whole story together. Next slide, please. So a little bit of where we were and where we're going. In summer of 2020, we began a big process of updating all the governance documents. We had a number of issues in each document, and so we need to update them to match current statute or practice. We had a lot of redundancy between each document, so we wanted to reduce that redundancy so minor changes could be made to one document without having this domino effect where every single document had to be fixed because of quoted material in other documents. And then we had a need to address some system requirements as well. A lot of that's to match current operations and make sure that we're still, what our documents say is what we're doing, or what we're doing is what our documents say. And so it's been going for a while now. In the fall of 2020, we came to you in October for minor changes to the code and to recognize the EMS Alliance, which allowed us to work very closely with the newly appointed alliance throughout this whole process. The fall after that happened, and then going to now and into the next few months, we are working really closely with the EMS Alliance to dive into these governance documents, starting with the code and admin rules and ambulance service area plan. Those 3 are at a point now where they're either coming to you today to start the process of getting those edits moving forward and into documented, or the ambulance service area plan, which is has a first stop at the Oregon Health Authority to make sure that it meets their requirements before we bring it to you for your endorsement. Next slide, please. So, as I said, we're working very closely with the EMS Alliance. Our alliance has representatives from all the fire agencies, and as well as our EMS partners at our 911, our EMS transport, and then the Alliance has work groups that we work with for various projects. For the governance document work group, we also pulled in some of our public or system utilizers who have been part of the EMS Advisory Council in the past. So we have that perspective at the table as well. And then you can see the representatives who came to that work group, which met more often and really dug into each of the documents to look at what needed to be changed and if that brought up any issues between the 3 documents. And so it was a really valuable interaction between the system partners. Once the work group got done reviewing each document, it went up to the EMS Alliance Governing Board, who reviewed the proposed changes, gave feedback, asked questions, sent them back to the work group in a few cases, and then ultimately gave the thumbs up to bring these 2 documents to you starting today. Next slide, please. So what we're doing really over the next few months, and there is a change this morning, so bear with me. Today we're bringing you the code and admin rules to get this process, and we're looking to come back to you in board meetings in a couple of weeks, and then a couple of weeks later. In March or April, we will be bringing the ambulance service area plan to you for endorsement. That's been pushed back a little bit because like everyone, OHA is dealing with COVID, and they have let us know that while they have 60 days to review, they may have to push it out either to that full 60 or a little bit past, just because of surge efforts right now, which I fully understand. And then also March or April, we'll be bringing to you for review updates to the franchise agreement. We are contracting with Fitch and Associates, which is a national EMS specialist, to look at the language in the current document and recommend some modernization and some updating to that, but then also to develop a 5 to 10-year plan to do some bigger updates and the metrics that we look at in the EMS system to make them overall better for the quality of the service given. Next slide, please. So at this point, I'm going to pass this off to Tim Case, who's our Senior Program Coordinator within EMS and has led the work group work with the EMS Alliance through this whole process.
Thanks, Adrian. Good morning, Chair Harrington, Board of Commissioners. As Adrian mentioned, my name is Tim Case. I'm the Senior Program Coordinator in the EMS program at Washington County. And I think a lot of my portion here is going to be somewhat reiterative of what Adrian and Marie mentioned in terms of scope of process and the inclusion of the group. I would like to start by saying all of the member agencies of the Alliance and those that participated in the work group that kind of dug into this work, it was a level of collaboration that I have not necessarily run into often in my EMS career. So the level of involvement from the agencies in the county is pretty high level, which is great to see. So there's a lot of investment. As I mentioned, I think the changes are kind of rather straightforward. And what we did is we wanted to modernize and contemporize these documents. In reviewing, there was a lot of outdated language. There was a lot of contradictory or unnecessary language. So we really did a good housekeeping and house cleaning of the documents to remove those things. There were some certification licensure levels that actually didn't exist anymore that were part of code and rule that we removed and updated. And so through that, I'll kind of elevate some of the higher level things that we discussed. But our end goal was to, again, like I mentioned, kind of contemporize the documents and also kind of set ourselves up to allow for innovation and kind of expansion of the EMS system. As medicine is an evolving practice, so too is EMS, and allowing us the flexibility to make system enhancement level changes is what what we really strive for. So the way we approached it is we started with the code, which is 8.32, and we really frame that as kind of the building blocks of EMS provision in Washington County. The code is, to use a sports analogy, that's the sport that we're playing. Here's kind of how it works. Here's some of the basics to it. So that really defined a lot of different things for us. And some of the major changes in that, as I mentioned before, were some definitions that we deleted because they didn't exist anymore. But also we added a few definitions. The highest level would be defining the difference between the emergency ambulance provider and a fire-based emergency ambulance provider. As the system works now, as you know, we have a contracted EMS agency that does the transport work. The fire departments serve as the first responder So it's kind of a dual dispatch system. And there are times and circumstances where fire apparatus or fire ambulances can and do transport patients from the scene to the hospital. But that wasn't necessarily covered or explained in code and rule. So we created that differentiation, added those definitions in, which also kind of built the ability for licensure of that as well, which is a practice that has been going on. And now we're just kind of catching up with that actual practice in code and rule. Additionally, as you can see in the slide there was some consolidation of sections. There are a handful of places where things seemed redundant and unnecessary. So as we consolidated those into a more appropriate section of code and rule. Otherwise, the other main thing in code was we updated our rulemaking to be more in line with other programs in the county. I think Brad Anderson could probably speak better to it than I can, seeing how he's the lawyer. But it seemed as though our rulemaking was a little bit different than kind of what would be standard for other programs. So we really realigned that. And in code, the other major change really was just kind of defining subcommittees that could be formed either by our program office or through the Alliance for just continuing work that comes up as the EMS system progresses. Next slide, please. And as we moved through code and got into the administrative rules, our approach was nearly identical, where we reviewed the document for any superfluous language, any redundant language, things that, again, definitions that didn't exist. There were a handful of places where words were defined that weren't used in the document, so we really cleaned those out. So again, a thorough scrubbing and that house cleaning of the document to bring it to a more contemporary standard. Again, consolidated sections that seemed to make sense and that were not necessarily needing to be standalone as they were previously. We had a pretty robust discussion on the expansion of medical direction and how that worked in the county. Really not with much resolve, but also understanding that the newer subspecialty of EMS physician is kind of building, and previously our admin rules didn't allow for that. It didn't even acknowledge that as a possibility for hire or contracting with an EMS medical director. So we kind of added that in to allow even more qualified physicians to apply for and be EMS medical directors within the county. Again, we went through and cleaned out language that didn't make sense. We also tried to align citations in both documents appropriately and made them a little higher level rather than picking the exact citation that can and does change from time to time, which was a thing that we ran into, citations that didn't exist anymore. So to keep the document a little bit more kind of living and flexible. And then there seemed to be some contract specific negotiable language in the administrative rules that to our work group didn't make sense to have things that could potentially be negotiated in future contracts, either with current provider or however the EMS system progresses, that it seemed as though we were binding ourselves to things that would end up being negotiated. So we tried to really look for that language and filter that out as best we could, and reserving that for franchise agreement type language. Otherwise, again, we really just had a lot of collaborative discussion. We got a little existential at times, but at the end of the day, I think we really kind of hit our target of contemporizing the documents and allowing ourselves to remain flexible to grow as an EMS system. And with that, next slide, please. And that's the end of my presentation. I open it for questions unless Adrian or Marie or Mira has anything else further to add.
Great job, Tim. Thank you, team. That is the end of the presentation. So Chair Harrington and commissioners, questions.
Go ahead, Commissioner Rogers.
Just one quick one. Again, you're the experts on these, and I certainly don't have any big issues in regard to language cleanup, but tell me what challenges these providers have in terms of meeting response times, meeting other qualifications that we historically have had in these agreements with COVID. People can't get people to take patients out of the back of vans sometimes, and there's a number of issues that happen around hospitals just because of staffing issues. Are we having to rewrite or revisit any of that?
I'm processing your question, so thank you. That's a great question. COVID has definitely impacted the way business is done, particularly at the start of the pandemic, in that there wasn't much known, obviously, about this disease. So things really kind of slowed down in terms of the amount of PPE that providers needed to don and doff per call. Additionally, another interesting side effect was a reduction in call volume because I think people were sheltering in place. They were nervous to go to the hospital to seek care because they didn't want to contract COVID. And so that delayed a lot of care that people would otherwise normally seek. So there may have been some more minor heart attacks or strokes that occurred that people didn't go to have addressed, only to later have some downstreams effect of that require them to go to the hospital. So that would then kind of demonstrate an increase in call volume as we kind of bounced back. So with that, as you can expect, more responses that would require more ambulances. But really, the way COVID is working and the way that these documents kind of govern EMS, there's not really a way to capture that in these documents. Hopefully, saying this 3 years in, COVID is a little bit shorter lived than our EMS system. So I think trying to account for that in these documents would be a temporary change.
How do you, Tim, how do you adjudicate, and again, I'm no expert, you all are, but how do you adjudicate differences of opinion in regard to, gee, you didn't pick me up timely, and I'm saying I'm the carrier and I have half my crew gone, so I don't have the number of people available to be at the service level that we had anticipated in the contractor. What if I pick somebody up, I'm a service provider, take them to the hospital, but the hospital won't unload them because they have too many patients in emergency care, or they just don't have enough staffing. How do you rate me? So are we getting into any of this? What does service level mean and responsiveness? Is that part of what you're rewriting? That's my real question.
Oh, sure. What we're rewriting in this doesn't really address that. So again, going back to my sports analogy, the code is kind of, this is the sport we're playing, whereas the administrative rules are just that. These are the rules that we have to play by, and that addresses things in terms of how clean and tidy your ambulances, what kind of stocking you have, the staffing kind of makeup of the ambulance. Right now in Washington County, we require 1 paramedic and at least 1 EMT. So it addresses those types of things. In terms of service provision, and it sounds like you're asking about performance, that's something that's better saved for the franchise agreement, which, as Adrian mentioned, we'll be coming back to you with in the kind of mid-future.
Other commissioner questions or comments? Okay, so seeing nothing further from our district commissioners, Tim, I just want to ask for, well, your additional assistance and/or from Ms. Donner or our other senior leaders, Ms. Bowman Davis or Ms. Samantel. I don't know who the person is I need to call upon, but I know I feel well served from this collection of experts. And my question is this. So in our prior discussions on both the EMS system and the code, as well as the franchise agreement, I have expressed my displeasure for a evergreen contract that is infinite in its rolling time period. Instead of that infinite rolling time period, I believe in a system where at a significant milestone, such as every 10 years, there is an RFP or an open assessment for all potential suppliers of such a service. And I believe I was informed that our Washington County system did not provide for that. And so I'm continuing to champion that. I believe that is a good public policy choice, and I would like to see us implement such a choice. We may get to the same detailed outcome in terms of contracts, that's fine. But I think that we do need to ensure that our overall system implements good public policy. So I'm not sure if that applies to, given that it is a policy direction, I'm assuming that it applies towards our work as a board on the code adoption. So I'm not sure, you know, I did review both the red line version and the clean version, and I don't know where things set for that. So help.
Adrienne, you want to take that question?
Yeah, thanks, Chair Harrington. We recognize the two ways of doing the franchise agreement, and so that again will come soon. But yes, our current franchise agreement, while the franchisee is required to meet metrics and can lose time and eventually work their way out of a contract if they aren't meeting the expectations, if they're doing well, they continue forward. That's the current contract. We did actually look at that language in both the code and ASA, which was real specific. And so we walked that back. So it doesn't have that specific, it will be, it doesn't say evergreen, but it will, you know, that exclusive right, so that it's not written there. One of the things, as Tim said, as we looked through these documents, is we tried to move anything that was too prescriptive and didn't make any sense, or was too detailed and didn't need to be in one document because it was going to live in another document. And that was one of the things that we looked at. So that language requiring the ongoing exclusive right to the franchisee, one single franchisee, was removed from both documents.
Thank you for that. What it causes me to, so I feel like I've been heard. Okay. Thank you. You might have to remind me again in the subsequent presentations. But it does lead me to ask a related question. As there are future commissioners, given that it's no longer prescriptive in the code and the ACA, how will a new board member be able to answer the question of Washington County has a system of reviewing this as opposed to it being handled at a staff level detail. So in practice, it continues to be an infinite evergreening versus that set 10 years. Because, for example, in our personnel code, I believe, Ms. Angie, correct me if I'm wrong, that we have an adopted policy of reviewing our personnel code every 3 years. So that is part of the code. So it tells me as a policymaker that I may have just started as a commission member at the beginning of that 3-year cycle, right? Or a 10-year cycle or whatever it is per that, aspect of our service portfolio. But I know that we have adopted that good policy practice. So
I think that's a really good question. And I think it's really important that as new commissioners come on, they understand the cycle of EMS, which is, and we'll be coming to you in a month or two with our 18-month assessment. So we deep dive with Metro West every 18 months, looking at not only their month-to-month, the metrics that we look at month-to-month with them, but then also additional metrics that we look at every 18 months. And that assessment comes to you for review. Normally, although not in the last 18-month assessment, we also bring updates or changes that need to happen with the franchise agreement, since that is an agreement between the county and Metro West. And this year we will be, because it's part of this overall process. And so that's the point at which we want your feedback on the 18-month and then also on the franchise agreement. The difference being that last 18-month, there wasn't any major changes to the franchise agreement. And I think we were in the beginning of COVID. So we opted not to make anything minor. And so this time we are bringing it back. And this is a point at which once the 18-month is reviewed, we decide, did they earn the next 18 months being added onto the contract, or do they not, or do they lose 18 months, which is spelled out within the franchise agreement.
Which we do not have. If we don't adopt a policy per code, then what you just said is, well, just trust us model. Okay. And that doesn't meet the metric of good policy, as I have been trained in good public policy at an elected level. So I'm still uncomfortable about that. Operationally, do I trust staff? Yes. With regard to staff examining and bringing policy options to the board for consideration, yes, I trust that too. But I continue to believe that we should be developing a code that memorializes on some major milestone, we will be doing this wide opening versus continuing to support an evergreen 18-month status quo as long as basic performance is let. So Commissioner Willie, we'll do another round of commissioner comments.
Well, actually, no, I'm just based on, excuse me, based on your questions, I'm a little bit confused in the way they responded to Roy's analogy. Excuse me. I'm confused if we're talking about administrative rules, which is what this presentation is, versus the franchise agreement update, which is we're going to get subsequently. So, so clarify if you would. I understand the concerns you have about the evergreen contract, and I've been aware of that for a while. So is that where we address, are we addressing that in the administrative rules, or do we address that in the franchise agreement?
So two things. I'll turn it over to staff in a moment, but since at first you were directing the question at me, When I heard Commissioner Rogers' question, it took me back to the information that the board was provided on December 15th. That is clearly the execution of the franchise agreement. I'm at that higher level board policy, which is then adopted through Washington County Code and the ASA and code. That's the level that I'm operating at the policy level. But staff can give you their answer because Ms. Donner took a crack at saying how the outcome that I was looking for might be considered.
Okay. Adrian, you want to weigh into that, or can I ask my next question?
Commissioner Willie, if it's okay, I'll go ahead and respond. So I just want to make sure I'm understanding the question because we're here before you today to really get your approval on the finalization of the code updates, and we'll be coming back to you on January 25th at regular session to consider those updates to EMS code and administrative rules. But what I'm hearing Chair Harrington say is she would potentially like additional changes to be incorporated into the code that would put a review by this board into code at some kind of time frame. So that's the question or the ask I believe I'm hearing. Okay, and that is something that we considered, but thought that putting term limits into the code and the rule would be too limiting, and that is something that is addressed in the franchise agreements, which again is what we're bringing forward to you, I believe in March/April. So I look to this board for your guidance and direction.
Well, I guess my initial reaction would be that modifying the evergreen contract is something that I think we as a commission should be discussing corporately. And rather than just giving you direction from the chair, I would like to have more conversation about that to discuss implications and what all that would mean. Because again, I thought that was the only place that was addressed was in the franchise agreement. So that's a subsequent conversation. So if it's not, it's going to be considered to be, we're changing administrative rules to facilitate that, then we need to have that conversation as a commission as to what exactly that looks like. Because to follow up on Commissioner Rogers' conversation is that questions about what if, I think that's really pertinent to our situation right now. I mean, we're seeing it in businesses that they can't stay open the typical hours they usually do, so they're reducing hours, or they don't have the employees, they have COVID impacts on the employees they do have. And I'd have to believe that our ambulance services and our fire services, just like our departments in the county, are having some of the same issues. So I think we need to take that into consideration when we are doing an evaluation. As I understand, we're doing the 18-month evaluation, going to start that pretty soon. So anyway, it's kind of a bigger picture. And so now I'm concerned a little bit about the administrative rules that I thought was just kind of cleanup is moving towards something that is a policy change. That's different than cleanup. So maybe I'm totally wrong on this. Maybe if I'm chasing the rabbit going the wrong direction, then just tell me. But so maybe I just feel like I need to have more conversations about this.
I'll just say once again, I'm working to stay at the policy level. I think I have a clear understanding, both from this written material in our packet, the presentation, and the verbal articulation about how our staff works, operationalizes the system of the 18-month reviews through the franchise agreements, and that they are empowered to renew the franchise agreements based upon performance. I'm not trying to mess with that, okay? When we did empower them to do this review with the EMS Alliance, once again, it's sticking at the policy level, and that's the level that I continue to endeavor to operate in. Mr. Carr, you have something to share.
So Chair Harrington, this is all great feedback from the board, and your level of interest is terrific. And perhaps I could suggest that my team could work with this group and see if we can bring back some proposals to the board to address some of the issues you've raised today. I think Commissioner Willie is right that this is intended as a cleanup of some code provisions and some administrative rules, but there are significant issues, it sounds like, that board members want addressed. And I'd be happy to work with this team and Brad as well to see if we can bring those back and help address them in a way that you find satisfactory.
So when I raised this question back in 2019, this was the time and project where it was suggested I bring this policy consideration. So I endeavor to be consistent. So I'm bringing the policy question back in at what I was told was the appropriate time. So I'm pleased to hear, Mr. Carr, that you think it is reasonable to take this feedback under consideration and consider it. Are there any other staff or board comments or questions? Okay, great. I think we've had a good, robust conversation about what the process is and what are the considerations to bring into place, and I appreciate that. Thank you, everyone. Okay, we'll then move on to a similar but different work session topic, the overview of the public health reaccreditation plan with some of our very same staff experts. Our interim director of public health, Ms. Mira Samantel, and our public health division manager, Marie Bowman Davis. And I'm going to leave it to them to introduce another staff member, subject matter expert that some of us have, or some of you may have had the opportunity of getting to know, but is a member of the team working on this major project. So Ms. Samantel, please take it away.
Thank you so much, Chair Harrington, commissioners, good morning. Just for the record, in case there's members of the public who are just tuning in now, my name is Mira Samantel, and I'm the Interim Director of Health and Human Services. So once again, this morning, I'm pleased to introduce you to Marie Bowman Davis, our Public Health Division Manager, who along with Alex Coleman, our Senior Program Coordinator, are here today to share information with you about our public health accreditation, including the value and the impact of this accreditation, and also to provide an update about the reaccreditation process. So with that, I will turn it over to Marie and Alex, who can take you through today's presentation and answer any questions that you have. Marie?
Great, thank you, Mira. Thank you, Chair Harrington and commissioners for having us here today to discuss public health reaccreditation here at Washington County. For the record, I am Marie Bowman Davis, the Public Health Division Manager and the appointed local public health administrator. And I have with me today our subject matter expert, our quality systems and performance improvement management senior program coordinator, Alex Coleman. Next slide, please. So we wanted to take a step back for the public and for those of us who were not here in 2017 when the county was able to achieve a national accreditation, which was a big success for the county and for our public health division and our health and human services department. And so that process started well before 2017. So we had a 2012 to 2016 strategic plan in the public health division where we wanted to achieve accreditation. And in 2014, I know this timeline's a little small, so my apologies. Hopefully it's easier to see in your packets. We were able to complete the accreditation application prerequisites, which include the community health needs assessment and our community health improvement plan. And in January 2014, we, with the support of the commissioners, submitted the statement to intend to apply for accreditation. January 2015, we submitted the application. May 2016, we submitted the required documents. And in January 2017, we had our official site visit conducted by the Public Health Advisory Board. And in March of that same year, Washington County Public Health, as part of the Health and Human Services Department, did receive national accreditation through FAB, or the Public Health Advisory Board. And so this is a 5-year process, and that we are accredited. We are accredited for 5 years. And so today, we are here to give you an update on where we're at in this timeline. So if we could move forward. So what is the purpose of accreditation? Why is it a great thing to be accredited public health department? So national accreditation indicates to the community that we are engaging in best practice among public health agencies nationwide. There are over 300 agencies that are currently accredited, including state public health, local public health, and tribal public health. It also signifies our county's investment to make our communities healthier. So accreditation holds us to certain standards, and which we'll discuss today. And they really, the accreditation provides us an evidence-based framework for public health programming and services, peer-reviewed, technical assistance, developing our performance standards so that we can have an ability to measure our progress against national standards. It also aligns with increasing the number of local accredited health agencies as part of our Healthy People 2030 goals. And this is part of our public health infrastructure across the nation. Next slide, please.
As Mary mentioned, so FAB, all health departments that receive accreditation through FAB or the Public Health Accreditation Board are required to demonstrate compliance with a series of standards and measures that fall into 10 domains. These domains align with the 10 essential public health services and provide a framework for basic services provided by the Public Health Division. So this slide walks through the first 5 domains. So domain 1 is really around assessing and monitoring population health status, factors that influence health and community needs and assets. Domain 2 is around investigation, diagnosing, and addressing health problems and hazards that affect the population. Domain 3 looks at communicating effectively to inform and educate people about health, factors that influence it, and how to improve it. Domain 4 is around strengthening, supporting, and mobilizing communities and partnerships to improve health. Domain 5 is around creating, championing, and implementing policies, plans, and laws that impact health. Next slide. Domain 6 is around utilizing legal and regulatory actions designed to improve and protect the public's health. Domain 7 is contributing to an effective system that ensures equitable access to individual services and care needed to be healthy. Domain 8 is around building and supporting a diverse and skilled public health workforce. Domain 9 is around improving and innovating public health functions through ongoing evaluation, research, and continuous quality improvement. And domain 10 is building and maintaining a strong organizational infrastructure for public health. Next slide. So as I mentioned, the FAB domains align with the 10 essential public health services. The 10 essential public health services is a national framework for public health to protect and promote the health of all people in all communities. To achieve optimal health for all, the essential public health services actively promote policies, systems, and services that enable good health and seek to remove obstacles and systemic and structural barriers such as poverty, racism, gender discrimination, and other forms of oppression that have resulted in health inequities. This slide is a little bit hard to see, or at least the picture is, but essentially these kind of fall into 3 big categories. It's really around how do we assess what we're doing? How do we assess kind of our population health? How do we develop policy to support good population health and assurance? So how can we assure that we are providing the services needed to the community so they can have the best chance of being healthy? Next slide. In June of 2020, the Public Health Advisory Board released a review of all accredited health departments and found kind of the following key things. So when they surveyed 1 year after becoming accredited, more than 95% of health departments responded that they agree or strongly agree that accreditation had stimulated quality improvement and performance management opportunities with their health departments. Numerous studies have reported that health departments have documented measurable improvements in the efficiency of processes, programs, and services, and increased effectiveness because of their engagement in quality improvement. 78% of health departments surveyed 4 years after becoming accredited reported that since becoming accredited, their health department has strengthened their relationships with key partners in other sectors. A longitudinal study done found that jurisdictions with accredited health departments, when compared to non-accredited health departments, offer a broader array of public health services, involve more partners in the delivery of those services, and enjoy a higher percentage of comprehensive public health systems. 89% of health departments surveyed 1 year after becoming accredited said that accreditation had stimulated greater accountability and transparency within the health department. 79% of health departments surveyed 1 year after becoming accredited said that accreditation had improved the health department's accountability to external stakeholders. In a survey of health departments 4 years after becoming accredited, 50% said that health department activities implemented as a result of being accredited have led to improved health outcomes in the community. And 61% said that reaccreditation had helped their health department use health equity as a lens for identifying and addressing health priorities. Next slide. So here at Washington County, through the accreditation process, we've seen improvements in several areas. Washington County Public Health strives to create a culture of continuous quality improvement. We have a quality improvement plan that is updated regularly. We conduct routine implementation of quality improvement projects at both the division and program level. We work to engage staff at all levels in the quality improvement process, ensure that staff have access to training and education to better understand performance management and quality improvement principles. One of the primary goals of the Public Health Accreditation Board is to ensure that equity and community voice are centered in the work done by public health jurisdictions. This includes maintaining a community health improvement plan and demonstrating how we engage partners from across sectors in our work from planning to implementation. FAB also emphasizes the use of data-informed decision-making. So we're required to demonstrate how we utilize best practices and evidence-based programs to improve the community's health, as well as demonstrate how we use data throughout our programs. This includes conducting regular community health needs assessments and ensuring that we're making data available to the public. Accreditation also ensures that we're utilizing good management practices. The standards and measures provide outlines for how we should interact with our governing board, how we develop programs to ensure that we create and maintain a flexible and sustainable public health infrastructure, and that the work that we're doing is funded in a sustainable way. Next slide. So the goal with reaccreditation is really to demonstrate how we've continued to build on the foundation we set with our initial accreditation. So we've been working for the past year to prepare for reaccreditation and are hoping to submit our application by the end of January, beginning of February. We are currently in the process of finalizing our required documentation, which will be due about 8 weeks after our application has been approved by FAB. And then a virtual site visit will be scheduled for about 6 weeks after we submit our documentation. Given that timeline, we would expect to receive a decision regarding our accreditation status by late summer or early fall. Next slide. So today we are asking you guys to provide a letter of support to the Public Health Accreditation Board in support of Washington County Public Health seeking reaccreditation. And I will turn it over to you guys for questions.
Commissioners, do you have any questions or comments? Go ahead, Commissioner Willie.
Yeah, thank you for this presentation. I'm a big fan of accreditation recognition, I guess, support, because I think it keeps us aware of what the industry or what this particular focus on public health is. And so I'm just, yeah, I'm supportive of us going ahead and renewing our accreditation with this. So thank you for this presentation update. It's very important we have these.
Other commissioners? Okay, so I'll go. Thank you very much, staff, for putting this presentation together. I know when I was reading the packet on Friday and over the weekend, we didn't have the benefit of this value information, and I think it's very important that we communicate that. So as such, I'm very supportive of moving forward with this and signing on to the letter of support. I do have a question. Your presentation did a nice job of stating overall, here's the value and impact of having and continuing to perform through accreditation, and that is great. One thing I've come to really appreciate as a board member, certainly our excellence to public health. Thank you, team. But also, sort of the downside is the overwhelming nature of finding consumable public health information. And it's just the vast array of data. It's hard to find a snapshot to various simple questions. So, and you know, I'm a firm believer in continuous improvement. So my question is this, you are accredited. I support your going through the process for reaccreditation. Similarly with the sheriff, I think as an organization, we're learning how to do a better job to speak to the values, but I have not yet seen a snapshot of here is how we assess ourselves, you know, going into an accreditation. Here is what our goals are for the next cycle, right? So here's how we assess ourselves. Here is here's our set of goals moving forward. So do you have such a snapshot? And I simply haven't been able to find it. Or is that something that you might consider putting together so that we're able to say, share to our community that, yes, of course, we're operating under best practices, particularly as poverty and health work together, but for our community to know that we are delivering on our commitment through policies, practices, and part of those practices are our investment decisions. Thoughts? Where do I need to look that I haven't found yet?
Thank you, Chair Harrington. I think that is a great next step for our team is to make sure that we summarize that and make it available for the commissioners as well as for the board. As part of this application process, we are pulling together a look back at what has happened in the last 5 years. And as for the benefit of the public, I have been here since September, so I am learning about all the great things that the team has been accomplishing. And so if you'd like, I can ask Alex to provide a quick highlight, but we can also work internally to provide that public-facing document for the commissioners and for the community.
It's up to you. I'm always interested in having, I'm always supportive of your having the time to step back and say, okay, what do we really provide? But if there's something you're really proud of or have at the tip of your tongue, go for it. I don't mean to just put you in the hot seat right now, Ms. Colvin.
No, thank you. It's a great question. And it's definitely one that, as we've been kind of prepping for reaccreditation, is one that we have kind of been tossing around. How do we do this better? Because we have found that we've done a lot of really good work over the last 5 years, but we don't always do a really good job of telling the community what that work is. And so one of the things that we've been kind of trying to identify is how do we do a better job of being more transparent with the community. We've done a really good job of kind of increasing that transparency internally, but we haven't done a great job of kind of making it really accessible for community members to figure out what we're doing and how it really is impacting the community. And so one of the ways, which I don't think this was mentioned in the slide, but one of the new requirements that will come out of this reaccreditation process is that we will be required to report on at least 5 population health metrics. And so we are in the process of kind of finalizing what those metrics will be. But one of the requirements with that reporting is that we are making that information available to the public. And so I think as we kind of work through figuring out what that system will look like, I think there's some opportunities there for us to continue to build that transparency across some other areas as well, and really start to highlight to the community how we are working, not only internally, but with our partners and kind of across the county as a whole to impact community health.
Well, the board has certainly heard a lot, not only from you, but also community partners and community members about how this global pandemic has really put a focus on health disparities and racial disparities. So now is a good time for us to put together at least a snapshot of that last 5 years as you do the tremendous work moving forward with reaccreditation and future policy and investment decisions that this board will weigh in on. Thank you very much for considering that. All righty, anything to close? Commissioners, thumbs up on the letter, question mark. Commissioner Fye, we need an answer. Great, thank you. You've got 5 thumbs.
Thank you so much, Chair Harrington, commissioners. We appreciate your support and we look forward to moving forward with our reaccreditation process. Have a wonderful rest of your morning.
Terrific. Well, I see Ms. Angie is trying to figure out, since we're ahead of schedule by 45 minutes, approximately, if we might be able to advance our 1 o'clock topic. So why don't we give her a few minutes to see if she can do that. So. And while she's doing that, I have a board communication item and a question mark for Mr. Carr related. So I have been informed, my question relates to the upcoming Senate District 16 and 15 appointment meetings on Friday. I have been informed that there is publicly available video of at least the Senate District 15 presentations from applicants. So since it's publicly available, I assume it's a-okay for me to look at that. I do not know yet if that is available for the Senate District 16, excuse me, meeting. I'll have to ask the question of the DPO. I assume that's a more complicated one because it involves that convening was the precinct committee chairpersons from 6 different counties, or at least 5. So Mr. Carr, do I need to, as in terms of public and transparent processes, do I need to send that information link to all the board members? My thinking is that would be a prudent thing to do. What but I want to make sure I do things not only right, but well.
Yeah, well, I don't know that it's required, but I guess it would be prudent and it's fair that everybody have the same source of material in your decision-making process. So I would ask that you do share it with your colleagues and they can choose whether to watch it or not themselves.
Yep. Okay, so stay tuned. I'll send you that link today. Commissioner Treese, go ahead.
And on that same topic, I know that there was a call for public comment from the county. When will we get the results of that? Do we know?
Board Clerk Moss will answer that.
Thank you, Commissioner Treese. So I am in the process of making packets available for board members with all that material. For the Senate District 16, we have been sent 2 letters so far in favor of one of the candidates for that one. And for Senate District 15, the afternoon one, we have received approximately, I want to say about 12 letters for 2 of the candidates so far. So I gave them the deadline of tomorrow at noon to send any written comments so I can get to you, preferably Wednesday afternoon. And for Senate District 16, Columbia County has put the same deadline for that one as well, and will send us additional material as well as put it on their website, which I will note for you.
Are there any other board questions with regard to those meetings on Friday? Okay, so Ms. Angie has sent me a text saying that LUT is ready. So if the board is interested, we have an estimated time for the MSTIP presentation of 60 minutes. Would you like to press on with that topic? Okay, let's do that. Ms. Angie. And Clerk Moss, I'll leave it to you. There's a cast of at least 6 folks on the presentation list. So I'd like to just turn it over to staff to do the introductions and we'll go from there. Thank you.
Chair. Thank you, Chair Harrington. I appreciate LUT's flexibility. Ironically, they were just discussing this presentation as I reached out to Stephen. So we do have Stephen Roberts, Aaron Waddell, and Chris Deffelbach. Clerk Moss can watch for any other presenters in the participant list.
Yep. Thank you. Yeah, we will not have our partner from Espousal Strategies joining us today, and then we do have a couple of additional staff members, Joe Yonkins as our Capital Project Services Division Manager and Stacy Shetler, our County Engineer. They'll be joining, and they were primarily just going to be on hand for any questions at toward the end of the presentation. So Erin Wardell is our Principal Transportation Planner. She's actually going to walk through the presentation. I forgot to introduce myself, Stephen Roberts, Director of Land Use and Transportation. And Chris Deffelbach, who's LUT's Senior Policy Analyst, will be available for questions and discussion as we go through this as well. So I think with that, I'll go ahead and turn it over to Erin to walk us through the presentation.
Thank you, Stephen. Next slide, please. So our agenda for the presentation today is to share the equity framework and community engagement milestones and seek the board's direction on moving forward. We'll also be providing an overview of the past 2 funding allocations of MSTIP, known as MSTIP 3D and 3E, to review the programmatic allocations that were allocated for rural bridges, intelligent transportation systems, and the Opportunity Fund. We'll then be preparing for the future programmatic funding allocation recommendations. This is our first chance to have this conversation with you about what programmatic allocations you might like to see next time, or for this allocation, and then we'll preview our next steps. Next slide, please. So we wanted to do another review of our equity framework. When we were before you in December, we had a draft of the equity framework and we had the opportunity to review the purpose, goals, and objectives. We also talked about our community engagement goals and approach. We now have more final versions of those documents. I think it's important to note that these are intended to be living documents. So they change as we learn new information and as we're going through this process, but we would consider them to be in final form. And so those are included in your packet today. On December 13th, we reviewed this with the County Coordinating Committee, and we heard really strong support for moving forward with this framework and with the engagement plan. We heard a lot of appreciation for our continued work with city engagement, outreach, and equity staff. The County Coordinating Committee members did have suggestions for how we can measure our success as we go forward with this work and really evaluate the work that we've done. And then the Coordinating Committee asked to continue to be able to review the summaries of the engagement that we've done and our progress towards our outcomes. So it was a very good conversation and clearly a lot of support for this work. Next slide. So the next couple of slides recap the information that is within the equity framework in your packet. So the purpose of developing this equity framework is to implement a community engagement process that leads to equitable long-range planning documents and equitable outcomes in housing and transportation. As a reminder, we have Espousal on board as our consulting team staff extension for this work, and they are doing this work to support both the MSTIP process as well as our implementation of HB 2001. So that's why some of these slides refer to both housing and transportation. Big picture conversations with the community and really big projects for LUT, so it made sense to us to combine the equity framework for both of those. So this work will identify ways to address barriers that prevent our historically marginalized groups from meaningful participation and to deepen decision makers' understanding of who is considered an equity priority community based on previous county work, relevant community-based research, and ongoing data analysis. Next slide. The guiding principles of the equity framework is a set of core principles that are critical to the county's commitment to meaningful engagement and relationship building with these equity priority communities. We are working really closely with Latricia Tillman and Amanda Garcia Snell on this work as well, so that we're aligning as much as possible with the work that they're doing and also developing relationships that can continue to support LUT's work. So the principles are derived from regional best practices, and they include inclusion of diverse perspectives by identifying barriers to engagement and implementing strategies that break down those barriers. Timely and effective communication with community members, our community-based organizations, and our key stakeholders. Transparent decision-making processes, and a clear mechanism for accountability. Next slide. And the high-level objectives of this equity framework are to really just increase those opportunities for community input, prioritize our diverse and historically excluded communities as a part of our decision-making process. We want to provide community members with consistent and accessible information about how their feedback informs the recommendations and our decision-making processes. We want to use that input to inform our policies and our strategies, including the prioritization of the MSTIP program. And we want to reflect community input in our staff reports and recommendations. Next slide. So this slide summarizes some of those key definitions that are within the equity framework. And we reviewed these at the County Coordinating Committee in December and heard a lot of support for using these definitions. They're also consistent with work that the Office of Equity and Inclusion has prepared. So I want to read the definition that we're using of equity. Equity is the result of fairness and justice in the creation and delivery of public policy. Equity in Washington County will exist when every county resident has the resources to participate fully in the region's economic vitality, has access to the county services and other resources, and the opportunity to reach their full potential. We heard a lot of consensus and support for this from the County Coordinating Committee in December. Along with these other two definitions of racial equity and inclusion, we have heard feedback from our Office of Equity and Inclusion that we should also include a definition of transportation equity and really define what transportation equity means as a part of the MSTIP allocation process. So that is something that we are working on adding to our definitions. As I said before, this is considered to be a living document and we're learning as we go through the process. So when we find something that's missing that we need to work on, we'll have the opportunity to do that. Next slide. So this next slide shares a screenshot of the equity index that our consulting team has helped us to develop as a part of this work. This equity index is in some ways consistent with some of the work that TriMet has recently done on equity as well. What's different about this equity index versus some of the other ways that we've sometimes measured equity in the past is that in addition to considering the demographics of where people live, their neighborhood, the block group, or the census tract that they live in, This index goes beyond that, and it considers some of the infrastructure needs within these specific areas as well. So as a part of the math that goes into it, it's looking in these block groups and seeing, is this block group also identified as a food desert? Does this block group have a high concentration of identified gaps in our sidewalk or our bicycle system? Does this block group have an elementary school? Does this block group have a Title I elementary school? So we're really trying to dig a little bit deeper than just where people live and try to identify some of those other key pieces of a location that may make it high needs. So county staff are still working on reviewing this tool, and we'll be reviewing the math behind it a little bit more just to make sure that it's really accurate, as accurate as possible, and reflecting our understanding of the community, and that we haven't missed anything in it. But I thought it was a really good start, and I think it's a really good way to start to capture some of that complexity. But of course, it is only one tool. It's only one way that we can really look at the needs in our community and identify what projects are serving. So we're really happy to have it available. It is available as an online mapping tool, and so we can share it with our city partners, and they can use it as well for some of their projects. We're really enthusiastic about using it going forward as one piece of how we make these decisions. Next slide. So this slide segues into some of our big engagement milestones and actually some of our next steps as well. So our first phase of community engagement for the MSTIP program is asking the community what's important to you. And as a part of that, we'll be launching our online open house this Friday. So you'll see quite a bit of media around that. We're also going to be conducting 2 listening sessions later this month. And those listening sessions will deal with MSTIP as well as HB 2001. We're putting those on in partnership with some of our community-based organizations. We'll also be doing some focus groups in February and then working on targeted stakeholder interviews. So we think that this is a multi-pronged approach that'll really result in some good engagement around what's important to the community. In March, we'll be using that public input to help us craft the recommended project evaluation metrics for the submitted MSTIP projects. In July, we will have a prioritized project list to bring back to you and take out to the community to hear their feedback on the actual specific projects that are proposed by the cities and by the county. So in that August to September timeline, we'll be doing another big push with an online open house and focus groups and targeted stakeholder interviews around that project list, all gearing up to come back to you in December for the final adoption of the funding allocation package. Next slide. So we're going to cover this first section of the presentation first with some questions, and then we're going to move into talking about the programmatic allocations, and we have some specific questions. But I want to pause here for any questions on the equity framework or community engagement plan and find out if the board supports use of the equity framework for community engagement and that community engagement plan as we go forward. We also wanted to have a conversation if the board would like to consider a formal action on the principles and objectives in the equity framework, or are you comfortable giving staff more of a head nod direction at this meeting to keep moving forward? So it's an important decision point for us if we need to actually come back for some kind of a formal action on that work.
Commissioners, questions and thoughts? Who wants to go first? Or maybe nobody has any questions or thoughts. Go ahead, Commissioner Rogers.
Well, Aaron, thank you. I've worked with all of you long enough to know you think these things through, and I always appreciated that part of it. I still struggle with how equity, a definition of equity in terms of projects. You mentioned that earlier. I think we have some nice principles, but I don't know that those are specific definitions. So I have said, and I'll continue to say that people move around freely throughout the metro region, and so we all use the same highways. So I'm just trying to understand your definition. That's number one. And yeah, second point I would make, I'm very disappointed with the timeline in terms of bonding. I've made that, in fact, I made that comment in remarks I made yesterday to a group of folks that and this isn't your specific question on equity, but we're missing a huge opportunity in terms of bonding and projects and moving along. We know that the feds are looking at rate increases as early as March. It doesn't take anyone with any kind of mathematical background to understand very clearly that if we don't take a look at the favorable bond market today, and we attempt then to do projects on a pay-as-you-go in the future, and I understand you're looking at that, but you're saying, gee, we're not going to do anything until late December of this particular year, and that's not you. I'm saying generally in conversation. We've really shot ourselves in the foot in a very, very big way. So I'm making my comments. I've made them before. This isn't unusual. I'll continue to make them in the public. And I think we will be judged collectively by whether or not we were taking a look at doing things when we have the opportunity to fund at a very economical bond rate. So that's my comments. I'll stop.
Ms. Angie, on Commissioner Rogers' comment, as he also expressed this recently, I had understood from your answering that question that this is something that our current interim chief financial officer is looking into, given board direction to do just that. So am I mistaken, or is he correct in propagating the message that this board has said, no, we're not going to do that?
You are correct that our interim CFO is examining this, and I would like Director Roberts to also respond the work that LUT is doing as well.
Yep, thank you. So we're in the process right now of just firming up cost estimates for our current bonding project commitments. There will need to be some additional bonds sold in order to complete those projects. And then we'd also we're trying to run a parallel path of sort of evaluating potential bonding capacity and making sure that we are able to continue to fund our current pay-as-you-go program commitments. So we're working through that analysis now, and then we'll be meeting with the CFO to try to understand a little bit what our potential for bonding looks like. So we're hoping to wrap that work up in the next couple of months, I would say. I don't think we're waiting until December to try to help provide some feedback for the board to consider in terms of whether it may be appropriate to try to do some additional bonding.
Follow-up. My follow-up is that I'm trying to understand clearly the alignment. I appreciate, and Tanya, you shared with me that you're looking, and Stephen, I know you guys are too, but I don't understand the alignment of the time periods. And so that's what I'm trying to put in my own mind. If this particular part of the project isn't going to be done until December, and that's the lens we're going to use, how do we sell bonds earlier? How do we do things earlier than this particular schedule? So it's very confusing to me what the timeframes are. So
thank you for that question, Commissioner Rogers, and we'll follow up with clarity of that timeline and the intersection of the timeline with today's conversation.
Other commissioner comments on these two questions from LUT staff? Comments or answers? Commissioner Treese is thumbs up. Commissioner Fye is thumbs up. Commissioner Willie is thumbs up. Okay, so I'll provide the fifth commission work group responses. Yes, I do support this equity framework, and I am grateful for the document that was provided with the wealth of data that really illustrates all of the current conditions. I learned a lot and really appreciate it. I also appreciate the board leveraging the information resources. We have had to participate in grant funding opportunities for transportation projects, as well as for the regional transportation plan document using prior equity information. So I know you're experienced at it. So thank you. So yes, I support the framework. full steam ahead on that, and the use of the community engagement plan. I did review all of your materials. Excellent job. Fantastic information. On your second question, would you like the board to consider adoption of principles and objectives in the equity framework, or just give a head nod? I think, a head nod is good, but it doesn't send the same strong signal to our partners in all of this work. Not only our city partners, meaning mayors and city councils, but also their staff, in addition to all of the community-based partners, whether they be organized, community-based organizations, or somewhat grassroots level community leaders, that we are committed to this work. So I believe strongly that we should, by resolution, adopt the principles, objectives, and definitions. Yes, we reserve the right to get smarter, AKA better informed through the process to make adjustments. But I think it is appropriate for us to signal that this is a funnel. We are operationalizing racial equity in all of our decision-making, including our future transportation investments. We do historically, I know as a over 30-year resident of this community, that we have been required to look at equity data, but it hasn't necessarily been operationalized for stronger outcomes sooner rather than later. We've become a far more diverse community, and I think now is the time for us to send a strong signal that we are indeed operationalizing this and continue to work together in how we do that through this MSTIP 23-28 cycle. So that's my solid thumbs up on question number 2 as well. So I assume, since all the other commissioners provided their thumbs up, and Commissioner Rogers expressed that, if I am paraphrasing him right, that he is comfortable with the principles, but still struggles with the equity definitions. I respect his viewpoint on that. I've heard that viewpoint, but I still believe strongly we should move forward. Round 2, commissioners, any other thoughts on these questions? Otherwise, we can move on.
So we'll plan to come back with an RNO in February, at a future February meeting for your adoption or action.
Great. Terrific. Thank you.
Okay, so if we can have the slides back up, we will move on to talking about the MSTIP programmatic allocations. Thank you. So this slide is sharing the allocations of funds from the last 2 cycles, the 2014 to 2018 allocation and the 2018 to 23 allocation. So in both of those cycles, the board allocated $160 million for specifically identified road projects. The board also set aside funds for our, what we call the Opportunity Fund, which is available for competitive grant matches, for rural bridges, and for intelligent transportation systems. And so these next slides run through how that money has been spent specifically. Next slide. So the rural bridges allocation is really important to fill funding gaps on critical infrastructure on our county roads. Bridge projects are expensive, and so they tend to be more expensive than we're typically able to fund with our road fund allocations. So it's important to have the MSTIP funds available for when we have these large rural bridge projects come up. So over the 3D and 3E funding cycles, we were able to fund the replacement of 6 rural bridges and conduct engineering design for 2 others. So this slide talks about the 6 that were funded and then the 2 that have been under design. Next slide. On the intelligent transportation systems allocation, this is quite similar in some ways to our opportunity fund in that we're able to use these ITS funds oftentimes to leverage other funds that are available for intelligent transportation systems. So ITS is important because it improves our transportation system safety and efficiency more effectively through adaptive signal systems, advanced traffic signal controllers, and communications equipment and infrastructure. As I said, these funds are often used to leverage other funding sources and capital projects. We have used it to provide match for metro transportation system grants. It's been really successful in leveraging some of those other funding sources. So we've been leveraging more than $5 for each of our dollars invested, and it helps us to implement the county's ITS master plan. In the packet for today, you have a much more detailed data of what we spent this ITS funding on, and it's been a really successful program. Next slide. And then there's the MSTIP Opportunity Fund allocation. I really cannot emphasize enough how popular the Opportunity Fund is. Our city partners, as well as partners like THPRD, have been really successful in using this to be able to match other funding opportunities. Oftentimes our jurisdictions know that there's a great funding opportunity out there, they have a great project, but they just don't have local funds available to make that match. And the Opportunity Fund has been available to be able to do that. So we have, through these last cycles, allocated $12 million in opportunity funds, and we've leveraged about $63 million in other funds. It's a really unique opportunity that Washington County has to be able to support these grant applications. And it's really helpful, especially for some of our smaller jurisdictions. It plays a significant role in supporting bicycle pedestrian safety and trail projects in our region. Next slide. So that's a pretty quick summary of how we've spent these programmatic allocations in the past. I wanted to find out if the board has questions or comments on the use of these programmatic allocations over those last 2 cycles. As we move into talking about this 23-28 funding allocation, we want to kick off the conversation with you about what you'd like to consider for draft programmatic funding allocations this time around, and let us know what other information you may need to help inform that decision. And then the third question on the slide, because the Opportunity Fund is so popular, we have allocated almost all of it that was allocated for the 3E funding cycle. That's primarily because of the Council Creek successful grant application. So in the next year, before you're finished with adopting the next MSTIP program, there will be other competitive grant applications. Right now, Metro has the regional flexible funds available, for example, and there could be some other federal funding opportunities coming down the pipeline. So we're hearing interest from cities as well as from the county in being able to apply for additional opportunity funds, but we don't have the money available. So what we'd like to ask the board today is if you support committing to a placeholder allocation for the next cycle. We've proposed a $7.5 million placeholder reflecting what was allocated previously. This doesn't obligate you to only $7.5 million. If the board, as a part of these conversations, decides you would like the MSTIP Opportunity Fund to be larger than that, and that's what you want to adopt in December, that of course is fine as well. We're really just looking for your authorization that we can go forward with allowing cities and the county to apply for these opportunity funds. It's also important to note that we don't generally write the check the day that the Opportunity Fund is allocated or authorized to be allocated. So for example, Council Creek was a really large allocation of Opportunity Fund, but we don't have to obligate that until 2024. So we'll be well through the next MSTIP allocation cycle before we have to do that. And many of these other grant opportunities are on similar timeframes where the jurisdictions will ask for the funding, they'll be approved for the funding, but it'll still be 2, 3, maybe 4 years before they actually need that money to be available. So with that, I'll open it up to your comments.
Commissioners. Go ahead, Commissioner Rogers.
Aaron, Stephen, I mean, this has been a fabulously successful program. I mean, I can't think of anything that is better results. You say 5 to 1, it's even more than that in some cases, a little bit less in other cases, that's an average. But I'm personally, I'm fully committed to it. I have a couple of questions though. You know, with a little over $1 billion that Oregon's going to get in regard to some infrastructure improvements that have to be allocated, some of them it's still unknown how much they're going to be programmatic. There we go. And or how much they're going to be on a basis of match. What do we have left? We're not even through 22, but we have some needs. Do you know? Can you give us an update on that program? And do we need to potentially look at backfilling a little bit in case some city or some partner comes in with a terrific project and we're saying, sorry, we have no remaining matching funds, but you got a wonderful project. Maybe we can help you out in 23. And they'll say we have to have already committed the funds and be well into building. Just update. I don't know where it's at right now.
Yeah, so that's really what this question number 3 is getting at, is that we don't want to be in that situation where we have some great opportunities, we're really competitive for some outside funding, but we don't have the ability to authorize a MSTIP opportunity fund expenditure. So as of right now, we have, I think, $241,000 left in the opportunity fund. But the WCCC approved the Salmonberry Trail request that came through yesterday. And so I believe that was $160,000 of that. There's also another $25,000 grant out there that a city is waiting to hear back on. So we really don't have very much left in the account right now. So with the board's permission today, what we'd like to be able to do is commit that there will be opportunity fund available in the next cycle so that we can go ahead and provide cities and the county the opportunity to continue to apply for these.
If I could just follow up, I appreciate your comment. I don't like it much, and that's just personally. And the reason is that had nothing to do with you. It's just that you have just said that with the addition of Salmonberry, you have nothing left in the pot, so to speak. And we're going to have some pretty big needs maybe in 22, and we're talking about 23. So is there a plan that we have if we have to match?
I think, Commissioner, what we're suggesting is really not a great analogy, but almost an advance on our allowance, if you will, right? So we're suggesting that the board, if you're willing to go ahead and commit that additional $7.5 million as a minimum placeholder for the next round of MSTIP, we would actually start using those funds to facilitate grant applications in 2022. And so trying it, as you said, our objective also is not to miss out on opportunities that may be forthcoming.
Thank you.
Other commissioner comments or questions or preferences? Okay, seeing none, I see Commissioner, well, I'll give my comments. I am comfortable with, for the remainder of 2022, to support some advance of 23-24 opportunity fund dollars as those projects, excuse me, are projects that we as the current board have currently weighed in on, such as Salmonberry Trail, right? Or that they are pursuing grant dollars in 2022 from new funding programs, such as the Infrastructure and Jobs Act, right? Of 2020, late 2021, early 20, it must have been late 2021. So So it's a yes, but within limits, right? Let me be clear about what I don't want to support. I just don't want to give carte blanche to providing opportunity fund dollars for grants that may not succeed through the criteria and equity framework of the 23-28 process that we're going through right now and plan to have completed within a year's timeframe. So I think it's very appropriate to move ahead with projects that have that level of readiness, but that they're going to continue to go through the process that we've outlined here for 23-28. And I have no idea if any of those projects would not meet the criteria at all. I have not a clue, no guesstimate whatsoever. So I am very comfortable with some advance. I don't feel like I need to be any more clear than that, what portion or any more precise, but just know that there are reasonable limits. That's all. And maybe that's why you came to the 7.5 million. I've heard a lot of numbers here and I'm not sure I captured them right. So I should have played them back. Aaron, please correct me on the question of what's left, so to speak. Was it, here are the numbers I wrote down. 241,000. Salmonberry Trail has asked for 168,000 and there's another city at the ready with 20,000. So
I think there was 25 for another grant application, I think.
So 168 and 20K right now, and we're sitting here in January, right? We're only 2 weeks in. So we can at least cover those already. But what we're trying to be ready for is to be responsive on grant cycles that may be operating between now and when the 23-28 process is adopted within a year.
Exactly. And so we know specifically Metro's regional flexible funds will be due in, the applications will be due in February. And so that's really the critical piece is jurisdictions applying for those RFFA funds and needing to know if they can use MSTIP opportunity funds as the match. And as we've talked about, there could be some other opportunities coming up with federal infrastructure bill or other things that we don't know about yet. We would still use our process for evaluation of these proposals, and they would still go through the WCCC for approval. So we're not asking to change anything about the process. We just want that assurance of certainty that there will be some opportunity fund available in the future.
All the better.
Yeah, and I might add too, Chair, I think that your point, if folks are applying for grants through Metro, they do a really exemplary job of evaluating projects based on equity criteria, equity focused. And I think in the Infrastructure and Jobs Act, that's going to be the same, a very similar lens through which they're looking at those projects. And so I think that projects that will be competitive are going to really be in line with what I think you're suggesting anyway. So I think that's all good indicators.
Well then, I join Commissioner Rogers and Commissioner Treese in being thumbs up, as do the other two commissioners. Great.
Great, thank you.
Woohoo! What's next?
I think we have some next steps. Here we go. So we will be back on January 25th. As I said, we briefed the WCCC yesterday about the draft evaluation metrics and our process for incorporating community input into the proposed evaluation metrics. So we will be giving you that briefing on January 25th. We couldn't fit all these topics into one, so we're back to cover that with you. And then we're coming back on March 8th. And at that time, we'll be looking for a little bit more direction from you on moving forward on the programmatic and project funding allocations. We don't need to be 100% certain at that point, but we want to know big picture ballpark amounts we should be aiming for as we go through with these conversations with the cities. And then we'll be looking at some direction, looking for direction from you on the evaluation metrics that we should use going forward. And we'll be asking for your initial direction on release of the project application form that the cities and county will use to actually submit projects. We won't be asking you to direct us to release that until April, but our goal is to have a draft of what the application form will look like in your packet for that March 8th meeting, and we can have a conversation about it and how it matches up with the engagement that we've heard from the community, the results of the engagement, and then the evaluation metrics conversation. So quite a bit coming up in the next couple of months.
So it sounds to me like you're trying to get us to milestone 2.
Absolutely.
Did you want to flash that slide up?
Next slide. Yep, here we go. So this is our timeline as we go through. So as the chair just said, we are moving rapidly towards milestone 2, which is getting direction on the release of the project solicitation packet. And then we think we're on track for a December adoption of the full program. And that's all we had for today.
Commissioners, any closing questions or comments? Go ahead, Commissioner Willie, Vice Chair Treese Willie. Vice Chair Commissioner Willie. Oh, goody, good grief.
My new name is Treese Willie.
No.
It's not
I'm
hyphenated,
sorry.
is it? I hope not.
But at
Anyway.
least I made you laugh. That's great.
No, that's fine. No, I just want to say, and again, extend my appreciation. You know, I had some concerns about this months ago. You've done a great job of making sure that those have been alleviated and kept me in the loop. So thank you very much for your hard work on this. You've done a great job.
So I will just add that I appreciate the how you've really made improvements, including the level of transparency and engagement with the community members with this cycle. And community engagement is always a challenge, right, for government. I would like to urge you to take advantage of our current website as well as the new website launch in April, and take the contents of today's work session topic and package it up to so that people can find the story of how was the Opportunity Fund used, right? What are we aiming for with equity with 2328? Because you are doing excellent work. And I know that the Land Use and Transportation Department particularly has a great group of folks working on communications in concert with our lead communications director, Philip Bramsford. So I want to urge you to make it easy for our community members to find.
Definitely. Message heard. We will work on that.
Yep. Yeah.
And I find.
No, go ahead.
And I was also going to add as a final closing comment that I'm finding these regular check-ins with the board on this program working for me. It's very consumable information on the journey. So thank you very much.
Great. Yeah, and I wanted to just add my appreciation for Chris and Aaron, and we have a team of folks that are really putting a lot of muscle behind this, and Joe and Stacy are with us on the call today too. They're both pretty integral parts of success in the program and their teams as well. So we have a really good team, and appreciate the opportunities to share the journey with you all, and we'll work on making sure that we're sharing that with others too.
And I'm also grateful, if I haven't said this enough previously, for your hearing our requests and going and engaging with the full city councils through this program. Really appreciate it. I think that is continuing to solidify and show that we are in partnership. We mean it. We're doing it, and we're doing it together. So thank you.
Yep, and those have been extremely helpful for us too. Yeah. All right.
Terrific.
Thank you so much.
Well, I think that's everything for our work session for today. Are there any final closing items from board members or from our executive leadership? No? All righty. Well then, with that, I will adjourn today's work session for January 11th, 2022. Thank you, everyone. See you Friday.